All right, and we are live. All right, welcome everybody. My name is Patricia. I am your class leader for this. I'm going to make this super easy. So if you can make it as hard as you want to, but I'm going to try to make it super easy for you. So when you get to the test, it's like, that was nothing. Okay. How many of you guys are stressed about the test? That's why you're here. Yeah, I'm going to make that test easy for you. Good morning. You can go ahead and have a seat where there's a red backpack. Good morning. Go ahead and have a seat anywhere where there's a red backpack. All right. So a couple of housekeeping issues just before we get started. Bathroom is the last door on the right. In case of fire, your exit is there. There's another one back there. I don't know why I have to tell you that, but the fire marshal says I do. So exit back there. Make sure you unlock it though, because you can't get out. It's locked. Let's see. Bathroom is last door on the right. There's a snack center and drinks, a little refrigerator that you can get whatever you'd like. I am not that kind of a teacher, guys. You don't have to raise your hand and ask permission to do anything in my class. We're all adults here. If you need to use the restroom, get up and go. If you need to step outside and take a phone call, feel free to do so. Good morning. Come on in. Have a seat anywhere where there's red backpacks. So, just be an adult. Handle whatever you need to handle. The only thing that I ask is that you try not to... There's one here. You can move everything over there if you want to sit near her. It's fine. The only thing that I ask is that if you're going to be late or if you have to step out at all, that you try not to disturb the class too terribly much when you come back in so that we can all get the information. I'm going to go through a lot of information quickly. Okay, a lot of information quickly. And if I get too derailed, unfortunately, we can maybe have to move some stuff to a later date. Does that kind of make sense? So I try to stay on track as much as I can. That doesn't mean I'm always going to succeed because I do tend to talk a lot. In fact, I'm going to talk today for 4 hours nonstop. Yeah, I will give you a little 15-minute break in there. It's more for me than you, but I will talk for 4 hours nonstop. There is no such thing as busy work in my classroom. You're not going to do homework in my classroom. I'm not going to sit here and stare at you while you're reading. You can read at home. I got way too much to tell you. So everything in this classroom is going to be very engaging. You're going to hear me. We're going to talk about things. We're going to have discussions, but it's going to be present. Does that make sense? Okay. You will have homework. We'll get to that later. I know, dreaded homework. Nobody likes it. I get it. But it is something that we will need to do to get the information we need. Sound good? Sound good? Any questions before we get started? Like I said, my name is Patricia. Everybody in YouTube world calls me Miss Patty. I am very well known. We are the #1 CNA training channel on YouTube. We have over 35 million views and 135,000 subscribers. So we are really big in the virtual world. One of the books that you're going to be using was written by me. It is the 3rd most popular CNA textbook in the country. Now, I don't tell you this to pat myself on the back. I tell you this because you need to know that I am a subject matter expert in Prometric testing. That's what I make my living doing. I speak at conferences. I teach instructors. I'm very good at what I do. So that means for you, all you have to do is stay reasonably awake. Okay, sound fair? Okay, so if you take a look at the back wall, all along the back wall, see all those pretty colorful puzzle pieces? I know you guys on, the internet can't see it, but all those pretty colorful puzzle pieces, We are going to learn all of that by week 2. But it's not memorization. I'm not going to give you something to memorize. That makes no sense. You will forget what you memorize as soon as you're done with it. I don't find memorization to be helpful. Not when we're going to be taking care of humans. I don't think that memorizing is a good strategy. I think that learning and making it a part of your practice is a much better strategy. And that's what we're going to focus on here. So I'm going to tell you how to do certain things. Certainly, you've got to be able to do that to get past the test. But I'm also going to explain to you why we do them a certain way and what the consequences are if we don't. Sound good? Okay, so we're going to make this super easy. Just stay reasonably awake and we'll do good. So this class does meet on Mondays and Wednesdays from 9 to 1 for 4 weeks. This is, I normally don't open the door until about 1:15, so kind of factor that in. I chronically run late. I am time blind. It is horrible. So I probably won't get here until about 1:15. So if you're an early bird, go get a cup of coffee. I won't be here. Okay. So 9 to 1. Because we are in a new room, there is no practice area. Okay. But you all have practice kits. So I just gave you practice kits. That kit, that red bag, what you guys see up here, these red bags you are going to bring to every class. Your books will slide right into that kit. Everything in there is, everything in the red bags is yours. You will practice with it. You will use it. It is yours. Now the books are yours to use, at least the yellow book. The spiral book is yours to keep. You're going to write in it. That's the one we're going to use in class. But the yellow book, you're going to take home and leave it there. You'll bring that back on the last day, but you don't need to shuttle it back and forth. There's no need. We don't work out of that book. Okay? So the yellow book goes home with you at the end of the day today, and it stays there until the last class. And then you'll bring it back and return it to me. But your red backpacks need to come with you every single class. Sound good? And your skills book, the spiral book, is going to slide right in there. And it will make sure that you have that book. If you forget your kit, I can work with that. If you forget your book, you're going to be making friends with a neighbor. Okay? Good? Good? All right. We have a large class here, so I'm not going to go around and ask everybody's name. Truthfully, I will learn it by like week 4. It's a big class. Okay. All right. We don't have the practice room, so I got to take that off. But you are going to receive wrap-up emails after each class. You see this. So those of you who just came in, this is a sheet that has your name and your email address. I need you to look at your name, make sure it's spelled right, and make sure your email address is correct. If it is, just write your name here so I know that you've seen it. If you need to make any corrections, make them in that block. Did you do this already? Okay, who needs to do this still? Do we have everybody? Okay, I am not going to answer that then because it looks like everybody is here. Okay. All right. So the reason that I need that sheet is because I'm going to send you a wrap-up email after every class. This is probably the most important thing that you need to get. Like I said, I'm going to give you a lot of information, and I'm going to do it pretty quick. And when you get home, you're going to be like, wow, there was a lot of stuff we went over. And you're going to need something to help remind you of everything that we learned. So in that wrap-up email that I send out are links to the videos. There's the link to the replay of that class session. And there's some helpful tips related to what we went over. So if you did not get an email from me about the class location change, I sent an email out to everybody on, I think it was Wednesday or Thursday. I had probably 6 of them bounce, which means that you did not receive that email. If you did not receive an email from me, you need to come see me after class, because I've got to find a way of getting you that, that wrap-up email. That's going to be very important to you, not to me. This is for you. Okay. I promise not to spam you. I don't send emails out for no reason. Okay. But this would be very, very important to you. All right. So this book right here, the CNA Skills Study Guide, this is your book. This is the book that we are going to focus on in our training. This is the one that I am going to refer to a million times. You're going to need this book to you. Those of you who are viewing this remotely, if you don't have this book, there is a link to purchase it on flcnatraining.com. Let's see here. Good morning, Helena. Good morning, Bliss. So when you, we were talking about earlier, comments. When you send a question or a comment, I put it up on the screen like this. This is live, real time. So everybody say hi, Raz.
Hi, Raz.
So if you're attending virtually from home, remember you can still ask questions. Just do it through our YouTube or our Facebook page. We turned the air on. I forgot that. Oh, we're missing one. Okay. Thank you. Let me turn this on here. Sorry. If it gets too cold, let me know. If it gets too hot, let me know.
Ma'am?
Yes.
Yeah, I need.
You
I
forgot to
think I
sign
need
it.
to sign up.
Oh, okay. Whoops, I am going to trip.
Thank
Thank you. All right. So remember, when I say your book, this is always the book I'm talking about. All right. So speaking of that book, let's open it up to page 17. We're going to go through everything else a little later in the program today. We're going to talk about your syllabus and the homework and how everything works together. But before we get there, we have to lay a foundation. We have to be able to have something to build on. So we're going to start here. Page 17 has skill rules. Now, if you look closely, this banner looks a whole lot like the one at the very beginning up here. So this is what we have on the wall there. By next class, you are going to be able to tell me everything that's on here and what it means. Okay? This is called skill rules. This is what determines what we do with every single patient. Okay, good? Make sense? So it's going to be involved in every skill we learn how to do. Now, when you look at this page, down here, you'll see a little video clapboard. Anytime in any of the lessons in this book that you see this little video clapboard thing, it means I have a video for this. Okay? So if you want to go back and review that video, you can do that. Those videos are going to be on 4YourCNA.com, my main site, under CNA training, animated lessons. So anything that has a video clapboard is going to be on my main website under animated lessons. Now, let's see here. I can't get there right now. All right. If you go to flcnatraining.com, remember we went through that earlier today, flcnatraining.com, I have a link for animated lessons on there too. So you can get there either way. But that's going to be important. Now, one of the things that we're going to talk about really upcoming, I just lost that word. really soon. Thank you. Right here. Do you see this little house-looking guy thing? House-looking guy. You guys over there may not be able to see it, but it's up here. It's up here. This is our scope of practice. You see it on the bottom of each one of those banners behind you. This is our scope of practice. Anybody know what a scope of practice is? Anybody ever hear that term? Scope of practice. It's very important in medicine. Very important. It means that we are going to do the things that our modality, our title allows us to do, and nothing more. So as a nurse, as an RN, I can't go in and act like a doctor, even though I'm still part of medicine, right? I have to do the things that nurses do. As a CNA, you are going to do the things that CNAs do. Make sense? So this is to help keep those lines from getting blurred. Now we're going to go over this quite a bit in a few minutes, but be aware that this is what's going to keep you out of trouble in your career. A lot of, I'm plugged into a huge amount of Facebook CNA groups. And probably one of the most common types of questions that I see is, am I allowed to do blank? Am I allowed to whatever? And all the comments, it's like the Wild West out there. Yeah, girl, we do that in our facility all the time. Or don't you dare, you're going to get your license taken away. And it's just all this conflicting information. I call it noise. And it's because a lot of CNAs that are out there were taught how to do the skills, but they never really learned their scope of practice. And this is what will get you in trouble legally if you don't understand this. So yes, we are going to learn the skills, absolutely. But if you don't know your scope of practice and when to do those skills and how to do those skills, knowing how, me teaching you skills isn't going to help you. Good? Does that make sense? So keep in mind that we're going to cover this in just a few minutes. But what we're going to talk about now forms the basis of this, the foundation of this. So I could stand here and explain this to you, but this is the one video I am going to show you in this class. So we're going to watch a video. Again, right up here, you see the video clapboard. That tells you there is a video for this, and I'm going to show it to you. This is the notes from the video. You don't even have to take notes in my class. I've done all the work for you. Again, stay reasonably awake. Okay. So all of this, the notes are going to be here. Again, we have that skill rules, that banner that we're focusing on. And this lesson is going to talk to you about the activities of daily living. Now, again, you don't have to take notes. When you hear that term in the video, you don't need to take notes on it. I've got all of that on page 89 for you. Okay? Any questions? All right, let me show you this video. Hi, Marcia. Hi, Tatiana. Okay.
The Care Plan and the CNA, why it's always about the care plan. A presentation brought to you by 4YourCNA.com. Thank you for joining 4YourCNA's online CNA test prep. We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for?
Certified Nursing Assistant?
That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions. This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient. In this online CNA test prep program, we're going to show you how to do all tested skills. But that is only the beginning of your education. You will learn way more on the job because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the Activities of Daily Living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. And they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone, but we will let them continue to do the things for themselves that they can do.
How will I know what I'm supposed to do with each patient?
I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it into perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her. She can't get out of bed, so I have to figure out the best way to meet her elimination needs: bedpan or catheter. I also know she is at risk for constipation. Since she's not moving much and she's on pain medication, this is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at meal times, and they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days, and she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly?
I can.
Absolutely.
Sure.
Yes.
Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. But you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness around a wound, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that a patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does. So you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged.
I'm not sure I understand. Are you saying the care plan is going to change all the time?
Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. but you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving.
Doesn't this mean that I'm going to be bothering the nurse all the time? Won't they be annoyed?
The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities, like nursing homes and ALFs and even home care. But in other settings, like hospitals, rehabilitation centers, and hospice, patients' health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer, and the nurse is legally liable for that. Remember, you are an assistant. You are there to help, but the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When the patient is stable, you will not have much to report and may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks, CNAs follow the care plan, and report changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs?
The care plan.
As a CNA, you follow the care plan, the whole care plan, and nothing but
The care plan.
anything unusual that you notice about the patient, you must report it to
The nurse.
Great job. For the exam, you will receive a care plan. What should you do?
Follow it exactly.
That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson.
All right. You guys get it? What do we follow? Care plan. Pretty easy, right? So this is kind of like a giant game of Simon Says. You guys remember playing Simon Says in elementary school? Right? If Simon said to do something, you had to do it quick or you were out. If you did something that Simon didn't say to do, you were out. The only way to win was to do exactly what Simon said when Simon said it. And that was the only way to win, right? This is the same thing, but it's not Simon, it's the care plan. Make sense? So, are CNAs making decisions? Are we thinking? How hard can the test be, people? Think about that. How hard can the test be if you aren't allowed to think? Putting the pieces together? Good. But let me explain to you why this is important. I'm going to pick on you two. What's your name?
Ariana.
Ariana and?
Olivia.
Olivia. Okay, so let's say that Olivia is an RN. Okay. Now you don't know Ariana, do you? Do you know her?
Yes.
Oh, I gotta pick two other people. Okay. Do you guys know each other? Okay. What's your name?
Brianna.
Brianna. Okay, so Ariana is the RN now, and you don't know Brianna, right? You guys just report to work because work hires you. You didn't hire her. You just report to work. So you don't know her. However, everything she does, you are legally responsible for. You don't know her. You're not following her in and out of every room. But if she drops that patient, you are legally liable for that. How much did your anxiety just go up? Knowing that you could go to jail for the actions of another person. Is that sobering? As a nurse, that's scary, right? So you are only going to take that responsibility for things that you directly told her to do. If you told her to go in and take the patient out of bed and put them into a chair, and she does that exactly the way the care plan told her to, and something happens to the patient, we're going to look at how that something happened, right? But if your instructions were leave the patient in bed, don't get them out of bed, and you went in and decided to get them out of bed anyway, and they fell, do you want to take responsibility for that? No, absolutely not. So now you are out on your own, responsible for that action. This is the only way this works, guys. Because RNs are legally responsible for everything their CNAs are doing, and they don't know they're CNAs. The only way that can work is if the CNA is only doing exactly what the RN is telling them to do and nothing more. But they've also got to know how to do those tasks. Because you're going in and getting a patient out of bed and into a chair, we got to know how to do that without dropping the patient, so, there's no problem. So we're going to learn how to do these tasks. Okay? We're going to learn how. That's a pretty easy thing, really, learning how. It's understanding when and what the consequences are if we don't do it right. That's the part that we're going to focus a lot of time on. Does that make sense? And do you understand why? Everybody good? Am I going too fast? Question? Okay. All right. So we saw this in the video, right? This is the care planning process. By the way, all those videos I made. Okay. I do all the animation. I do all the artwork. I do all the voiceovers. I do all of that. So every video you see is me. So that means that you're getting all of the information from the exact same source. So it all will go together exactly the same. So what you see in the videos, you're going to see in our reviews too. So this is the care planning process. And we have to know where we fit into this. So we have a patient, and the RN is going to figure out what's wrong with the patient, and they're going to figure out all real problems and potential problems. Now, in reality, that's why nurses go to school. It's not to figure out real problems. I can look at you and kind of figure out your real problems. They're obvious, That's not really why nurses go to nursing school. Nurses go to nursing school to learn all the potential problems, all the things that could happen to this patient. That's why nursing school is 3 or 4 years long, because there's a lot of potential problems out there, and we got to figure out which one this guy's got. And then we got to figure out what to do about it. Right? If somebody has the potential for constipation, well, what are we going to do about it? We're just going to let them get constipated? What are we going to do about that? Well, it might mean that we're going to encourage fluid. So every time you walk in the room, you're going to remind Mr. Jones, hey, take a drink of water. Okay? It might mean that the patient shouldn't be in bed all the time. We need to get them up because our abdominal muscles are what, as they move, they're what actually moves stuff through your colon. So movement is good for constipation. Maybe we'll give them a couple Senecot. Maybe some prune juice. Maybe dietary is going to get involved and we'll give them some high fiber foods. So So we got a lot of options here. Which one is right for this patient? And then the nurse is going to make that decision. So they assess the patient, they figure out all the potential problems, they make decisions on what we're going to do about that. And then we write up the care plan. Now that care plan is nothing more than an instruction manual. It's going to tell you what to do with this patient. Anybody ever play that game telephone in school? Anybody play that game telephone? If I told you something and then you told her and it went all the way around the room and it got way over there, is it going to be the same story? No? So this is why care plans are mostly written, because you are not working with that patient 24 hours a day. You get to go home. You get to sleep. You get to have days off. You're not with them 24 hours. That means that somebody else is going to assume the care of that patient while you're not there. And if we have a verbal system, oh, this is going to break down pretty quick. That's why we have a written care plan. Make sense? Good. Now, that care plan isn't just for CNAs, though. This care plan is huge. It is going to have directions to the discharge planner, to the social worker, physical therapy, occupational therapy, speech therapy, nutrition and dietary. There's going to be so much to this care plan. We don't care about all that. That's not our discipline. Our discipline is CNA. So we are going to get the information from the care plan relevant to what we are responsible for. Now, this usually comes in the form of a shift report. Okay, good. Now, shift reports are mostly verbal. So there is a potential there for some cross lines of communication. But remember that there's always a physical written copy of the care plan. Now, if you're going to go to work in long-term care, so this would be assisted living, nursing homes, things where patients are there for weeks to months to years to lifetime. Those report sheets are usually pre-printed because Henry doesn't change a whole lot. Henry's the same today as he was yesterday. So those reports are usually pre-printed, and that's your care plan for that patient. Tells you whether Henry stays in bed and has a catheter, or whether he gets up and goes to the bathroom with help, or if he goes to the bathroom all by himself and we're not involved. We like those patients. Okay. Now, in acute care settings where your patients change rapidly, like hospitals, most people are only in the hospital a couple of days, and their condition is going to change pretty rapidly. If they got admitted to the hospital, they were pretty sick. You can't just call the hospital up. Like I have had, trust me guys, the last 6 weeks of my life have been absolutely insane. Insane. I liquidated an entire 9,000 piece scrub shop in 4 weeks. I moved everything out of there in a week that was left. I came here and set up, I need a break. I need a vacation. Now, I can't call up my local hospital and say, hey, listen, I want to reserve a room for, let's say, 3 days, maybe a corner room, right? I need a break. You can't call up a hospital and do that. In order to get into a hospital, you have to prove that you are sick enough to be there. How many of you guys have ever gone to an ER? How many of you guys, when you went to the ER, were admitted? A few less hands. Do you know why? The whole purpose of the ER is to send you home. That is their purpose. They do not want to admit you. If they admit you, they have to prove why they admitted you. For you to get a bed at the hospital is a pretty big deal. It means you were sick enough to have that bed. If you're not sick enough, they just give you a prescription and send you home. Tell you to follow up with your local doctor. You have to be sick enough to get that bed. Do you ever think about that? That means the sickest people in our community are in the hospital. They had to prove they were sick enough to be there. This isn't a Walmart variety sick. This is serious sick. Now, our goal is to get them out in a couple of days. So if they were sick enough to get there, that means that they're going to have to make some pretty serious improvement pretty quickly to be well enough to get out in a couple of days. So that's a whole lot of change. Right? So acute care, our patients are changing like crazy. Henry is not the same today as he was yesterday, I can guarantee you. So in acute care, which would be hospitals and rehabs and even same-day surgery centers, that type of thing, your patients are going to change rapidly. So you're going to be besties with your nurse. They are going to know everything you know. They better, because they're legally liable for it. So it depends on what setting you're in as to how much you're going to be communicating with your nurse. If you're in long-term care, you might go 3 weeks without ever talking to the nurse because your patients don't change. Everybody's good. Oh man, we like that in long-term care. I don't want to see you. Because if I see you, that means somebody's not good. Okay, so long-term care, you hardly ever talk to your nurse. Maybe on break, that's fine, but not about the patients. Acute care or short-term care, you're going to be besties. Good? Make sense? I want to talk about this really quickly. This is kind of a side part to this. There are a lot of conflicts in healthcare. Unfortunately, it is a female-dominated industry. Not that females run it, but there's a lot of females in healthcare. And females tend to be a little cliquish and sometimes a little catty if we're with people that don't really ascribe to our own values, right? We don't like to think of ourselves like that, but sometimes that does come out. So you end up with a situation in some places where it's you versus the nurse. If you find yourself in that situation where you are not getting along with the nurse and there's a personality conflict and it's you versus the nurse, do you know who's going to lose every time? Keep going.
The patient.
Say it louder.
The patient.
The patient. Because you are focused on them, they are focused on you. Who's focused on the patient? Oh, wait a minute. Why are we here?
For the patients.
Yeah, we're here for the patients. So we've got to be really careful here. Okay, if you're in a situation where it's you versus the nurse, remember the patient is the one that always loses. Always. Now, in a practical standpoint, you are going to lose. You're going to lose. Because the nurse is the one that holds the liability. It also takes 3 to 4 years to train a new nurse. It takes, how long are you here?
4 weeks.
Yeah, 4 weeks. Right? So I can get rid of a CNA and get a new one pretty quick. If I get rid of a nurse, they are a little harder to come by. So in a personality conflict, you are going to lose every time. In reality, you should. Because your whole goal here is to do what the nurse needs you to do. Does that establish some pretty clear understanding of your role and your boundaries?
Yes.
Okay. All right. So remember, this is an ongoing process. So let's see if we learned what we needed to learn from this. Turn in your book to page 20. Now, this is a workbook. This is a workbook. So you're going to write in this. There's pens and pencils on the table next to you. You're going to write in this book. And I want you to take the next 10 minutes and answer these 8 questions. So go ahead and take the next 10 minutes and answer those 8 questions using the information that we just went over. if you're playing along at home and you have the book, page 20 is where this activity is. And when you're done, just put your pens down so I know who's still working. How's the temperature in here? Is it cold or good? Cold?
A little bit, yeah.
Okay. Your turn. Like I said, it's a new room to me, so I'm not real sure what it needs to be set up. Feel free to bring a jacket. Be about 30 more seconds and then we'll go over it. Looks like most people are done. Okay, let's go ahead and talk about each of these questions. Okay, let's look at number 1. You received the displayed care plan. How far are you going to walk that patient?
10 steps.
10 steps. Why isn't it until the patient gets tired?
Be careful.
Say it louder.
It's not in the care plan.
That's an easy answer. It's not in the care plan. We are ruled by the care plan. Even if the patient wants to keep going, we are ruled by the. Now, who should know that the patient wants to keep going? The nurse. That's right. So we're going to follow the care plan, walk that patient 10 steps, and then let the nurse know He wants more. Absolutely. Good? Good. Let's look at number 2. What do you need to help this patient walk? Okay, gait belt. Why can't we use a walker for extra stability? All right, easy answer is not in the care plan. We follow the care plan, the whole care plan, and nothing but the care plan. So we can't change that care plan. If it says gait belt, what are we using? Gait belt, period, end of discussion. If you think that it's not safe to walk this patient with a gait belt and you think the patient needs a walker instead, who should have that information? The nurse. Good? Good? All right. Let's go down to number 3. You received the display care plan. Which body part do you want to exercise here? Right hip, knee, and ankle. Why? Care plan. Sensing a theme at all? Right? But hey, wait a minute. Exercise is good. We all know exercise is good. You need it for digestion. You need it for respiration. You just need it for good overall health. Why can't we exercise other body parts while we're there? Because exercise is good. Ah, there it is. Not in the care plan. Even if your brain is trying to justify why this might be a good idea, your brain needs to be told it's not in the care plan. How hard can this test be, people? So during the test, you're going to get a, what are you going to do with the care plan? Follow it. Not hard. We're going to learn how to follow it. That's going to be from here on out. But the first thing that you need to learn is that we have to actually follow it. If you want to pass a skills test, all you have to do is follow the care plan. That's it. That's it. You now have enough information to pass the state exam. If care plan tells you to do hand and nail care, they really don't care how it's done. Just do hand and nail care. If care plan tells you to walk a patient with a gait belt, you're gonna
Walk the patient with a gait belt.
Care plan says 10 steps. How far are you walking them?
10 steps.
There you go. You now have the information you need to pass the test. We're going to refine it. We're going to learn more. But I need you to understand that what you have learned is the key. Not only to passing the test, but to being successful in the workplace. See, your focus is on the test because it's in your windshield. You know you've got a test coming up. And you know that that's a scary test because you have to do stuff and you have to answer questions and your future career is depending on that. That's a scary place for you to be. I get it. And you're focused on that test. I'm not. I'm focused on the day after the test where you actually have to go to work with real live humans that are depending on you knowing what to do with them, not how to pass a test. Because I might be the body in the bed. That scares me. If you've just been taught to do hand and nail care, but you don't have a clue what a care plan is, are you going to be a good CNA? 90% of the CNA schools out there are teaching you how to do hand and nail care, but they don't ever cover what a care plan is. And I'll prove it to you. Look in the back of your yellow book. This is the textbook that is used by CNA schools all over the country. Look at the index for care plan. Now, we would expect the care plan to be on every single page of this book because we know how important that care plan is, right? So look in the index for care plan of your yellow book. How many pages?
One.
How many?
One.
One. What page?
78.
78.
7 to 8.
Oh, 7 to 8. So this yellow book, if you go to page 7 to 8, is going to tell you about the care plan. So if you look on the end of page 7 and the beginning of page 8, it's going to tell you about the care plan. How important is this care plan? It is the foundation of everything we do. And yet the textbook, the main textbook used in CNA training, gives one paragraph on this care plan. This is why I do not like this textbook. This is why you're using it for homework, but we're not using it in class. Everything you're going to hear me say is going to revolve around the care plan, period. Because everything in your job is going to revolve around and the patient is going to revolve around the care plan. Good? Okay. So I am in the process of getting rid of the yellow book. You have an online program that you all will be enrolled in today after class is over. That's why I need that sheet with your email addresses on. All of you are going to be enrolled in my online program. The online program, we're going to go over in a little bit. It's going to give you a lot of additional information, but it's interactive. You have to do stuff in there. Makes it fun. But all of the lessons from that yellow book are going to be in the online program at some point. So we can get rid of that book because it does not focus on the right things, the care plan. Good? Questions? So these are the types of questions you're going to see on the state exam, the written test. If the care plan tells you to do something, what are you going to do? Do it. If you notice something while you're doing it, what are you going to do? Tell the nurse. It really is that easy. It really is. Now, where people get tripped up is they think it can't possibly be that easy. And they start making decisions. And that's where people go wrong. We have to know our scope. Okay, let's go down here to question number 7. Because this is important. Question number 7, what is our care plan asking us to measure? Okay, the radial pulse. That's what our care plan is asking us to measure, the radial pulse. Why can't we just go get all of the vital signs while we're in there? Doesn't tell us to. Let me tell you something about time management. You guys are going to have way more to do than you're possibly going to have time to do it in. There is no busy work in medicine. It is necessary work, but it's overwhelming. Every place is short-staffed. We are 1 million CNA short in America. 1 million CNA short. You're going to have way more to do than you can possibly get done. You start adding stuff in that doesn't need to be done, and you're going to run out of time. And patients aren't going to get the care they need. Does that make sense? But do you know who's going to suffer here? This is what happens. Okay? Let's say you got 12 patients, and you're working a 12-hour shift. And you're supposed to have a 30-minute break in there, right? 12 patients, 12-hour shift, you get a 30-minute break, lunch break. If you spend over that 12 hours, 10 seconds extra here, 30 seconds extra there, a minute extra there, if you just spend about 2.5 extra minutes over that 12-hour shift with each patient doing things that you don't need to do, you have lost your break. Now, I don't know about you, but in a 12-hour shift, I need my break. So time management becomes super important here for you. Does that make sense? Okay. So if the care plan says to take the pulse, we're going to go in and take the pulse. But don't add stuff in. You need that time for other tasks. Good? Does that make sense? All right, but let's go to question 8. This is the most important question down here, though. Question 8 asks you, how long are you going to count for? Say it louder.
1 minute.
Full minute. Why?
That's what it says.
That's what the care plan says. Yeah, we've learned that. All right, how many of you guys have people that you know that work in healthcare? Okay. I want you to go home and ask the people that you know that work in healthcare, how long do you count a pulse for? And not a single one of them is going to tell you to count for 1 full minute. Now, some of these people are going to be helping you practice. And they're going to try to be so helpful. They really will. And they are going to send you down the wrong path. Because almost everybody that takes a pulse takes it for 15 seconds and multiplies that by 4. In fact, if you go onto YouTube and type in, how long do you count a pulse? It'll be 15 seconds and multiply by 4. Ask Uncle Google and he'll tell you that you can do 15 seconds and multiply by 4. And that's one of the answers here, by the way. Well, actually, it's 30 and count by 2.
Yeah.
Or multiply by 2. So how come all of these other people are counting for 15 seconds and multiplying that by 4 to get our minute reading? And our care plan tells us to count for 1 full minute. So why is that different? Why are we learning something different that's actually being done out there? Now, a lot of teachers will tell you that, well, you're going to learn it one way for class, and this is the way you're going to do it in real life. That is absolute horse hockey. Okay? There is no learn it one way for class and do it some other way out there. If anybody ever tells you that, you need to not listen to them about anything. Because the only answer here that works is 15 seconds multiplied by 4 or 1 full minute will always depend on but more specifically, the care plan. Do you guys understand that? This patient right here has a condition. We don't know what it is. We don't need to know. We're the CNA. We just do. Has a condition that needs the pulse counted for 1 full minute. That's why we're counting it for 1 full minute. Not because, yeah, that's the way you do it for the test, but in real life you do it some other way. No, this patient needs a 1 full minute count. Some of your patients out there are going to need a 1 full minute count. But if you don't know the care plan, you might shortcut this. And who's going to suffer? The patient. Good? Do you guys understand that? Be careful about the advice that you get from your medical people at home. They're well-meaning. Absolutely. And they'll probably tell you, yeah, nobody counts for 1 full minute. And I get that. I understand that. And in a perfect world with normal patients, you're probably right. But if you got a patient with AFib, that's not going to work for you. And our care plan knows that. The care plan is going to tell you something different. So be careful about the advice that you get. Okay? Does that make sense?
Yeah.
Okay. Our medical people out there are well-meaning. I love them, and they're going to help you practice, and they're going to do a good job. But sometimes they might lead you in a direction that I don't want you going in. If you have questions, come ask me. Now, we know that we have to follow the care plan, right? And you know that you have a skills test coming up where you're going to have to physically demonstrate some skills. We're going to talk about the test in a few minutes. You know that that's coming. Wouldn't it be nice? Wouldn't it be helpful if you could get the care plan from the test beforehand? Wouldn't that be helpful? If I told you, Olivia, right?
Yes.
If I told you, it takes me 4 weeks to learn your names, guys. If I told you, Olivia, hey, listen, I've got the care plans from the test. You want them? You want them? These are 4 of the care plans from the actual test. If you get pulse, this is exactly what your care plan is going to say. If you get ambulate, this is exactly what the care plan is going to say. Now, the problem is that we have 20 skills that we have to learn. 20 care plans. This is only 4. You want the rest? Turn to page 25 in your book. These are all of the care plans from the state exam presented in the sets that the state exam uses. Elizabeth says, can you show me your schedule, please? Elizabeth, thank you for that question. We meet Mondays and Wednesdays from 9 a.m. until 1 p.m. for 4 weeks. This is class 1. We have 7 more to go. So page 25 in your book has all of the testing care plans. Now, each one of these, this is not random. This is not random. Each one of these has 3 specific skills. One of them is a mobility skill. One of them is an ADL skill. You guys remember what ADLs are? Bathing, dressing, grooming, toileting, you know, all the stuff we do every day, right? And one of them is a mobility skill, or I'm sorry, documentation skill. So a mobility skill, an ADL skill, and a documentation skill. Every care plan set is made up of one of those 3. Good? Make sense? You will get one of these 11 clipboards for the test. You will. Now, in your kits, the red backpacks, you're going to see this. This is in your kits, your practice kit. That's what those are. Those are practice kits. Now, you have this on page 25, but you also have these cards. And these cards have the same care plan sets in a card form. This is what you would get for the state exam. They're going to hand you one of these and say, do this. So you have these to practice with in your kits. Okay. So by the time you get to the test should be a no-brainer. All you got to do is read those and do them. Okay. Good. Am I going too fast for anybody?
No.
All right. So we talked a little bit about our scope of practice. Let's go back to page 22. Talked a little bit about our scope of practice. And again, I have a whole video on this. I'm not going to make you watch it, but I have a whole video that you can watch on your own about scope of practice. But this is where CNAs generally don't get in trouble about too much, okay? Because nurses have the liability, not the CNA. CNAs don't really get in trouble too much unless they do something that's completely outside of what they learned to do. As long as you're following the care plan, you're good. You're fine. We're going to talk about liability in a minute. But where CNAs generally kind of go off track is they start to make decisions on their own. And that's outside of our scope of practice. So let's look at that first example here. The care plan says the patient must remain upright from 7 a.m. to 9 a.m. every morning. The patient is sitting in a chair at the bedside and asks the CNA to assist her back to bed at 8:15 because of back pain. So let's think about this scenario for a second. We got a patient sitting in a chair. It's 8:15 in the morning. She says, oh, my back is hurting me. Can you help me back in bed, please? And the CNA is like, yeah, I mean, your back hurts. Sure, no problem. And helps the patient. Seems like a good thing to do, right? Seems like a good thing to do. CNA helped the patient back in bed. And the patient had an episode afterwards. Now, the CNA is liable. The CNA is liable because the care plan said the patient had to remain upright from 7 to 9. Now, we don't need to know why. I know some of you are thinking, why? It doesn't make any sense. If her back hurts, why can't I put her back to bed? Right? This question, why, is what's going to haunt you. That is the hardest part of being a CNA. Why does the care plan say this? Now, if you are that person, go to school for nursing. We need good nurses that can connect those dots. But as a CNA, our job is not to ask why. Our job is to follow the care plan. So what you didn't know about this situation, it seems perfectly reasonable, but what you didn't know about the situation is the patient is on a medication that can cause esophageal ulcers if the patient is laying down. We need the patient upright so that medication goes straight into the stomach and then through the digestive system. When the patient lays down, all of those stomach acids bring that medication back up into the esophagus, and now we have esophageal ulcers causing bleeding, projectile vomiting, all kinds of really bad things. And all the CNA did was put them back to bed. Why is that so wrong? Say it loud.
Because it wasn't in the
It wasn't in the care plan. It was against the care plan. You think that nurse is going to take responsibility for that? Not a chance. It is all you. So this is where we get into trouble as CNAs, is we start to think. I can't overstate this enough. Who should know that the patient wants to go back to bed? The nurse. Who should know that the patient has back pain? The nurse. If you just put the patient back to bed, we got opportunities that are missed here. A simple backache in medicine is hardly ever a simple backache, people. Probably retroperitoneal bleeding. Yeah, I probably need you to get some vital signs on them. If blood pressure is low, patient's probably going into shock. But you put them back into bed. Do you see how in medicine, small things for you can be a big deal for the patient? And it's all because of what you don't know. Good? Make sense? Have I scared you enough? You can read the rest of those at your leisure. But we come to this.
Can you ask why?
Sure, you can. Absolutely. And when you start asking why, the nurses around you are going to encourage you to go to nursing school. That's exactly what's going to happen. And they will answer occasionally. But in reality, those nurses have so much to do that they probably aren't going to take the time to explain every single bit to you. You're going to have a lot. Let's take the situation we just had, right? We got a patient sitting in a chair, has back pain, and you put her back to bed. And you're a good CNA, so you go tell the nurse, hey, she had back pain, I put her back to bed. And the nurse is going to go, go get some vital signs, quick. Get them sitting up. Quick. Put that head of the bed up. Quick. You're going to go in there. You're like, well, what's the big deal, right? Because that nurse knows that patient is on a blood thinner. And that blood thinner can often cause the GI tract to bleed into the abdominal cavity. Now, the first sign of that is going to be back pain. And the nurse knows that we just increased the dosage of this blood thinner on the patient. So when you come and report back pain, you're just thinking, hey, back pain. The nurse is thinking this patient is about to die because they have internal bleeding that we got to get stopped right now. Are they going to have time to go over all that with you? No. So they're just going to tell you, hey, go get them sitting straight up, get me a set of vitals quick. And you're going to go do that. So yes, you can ask. And I love when CNAs show an interest. And I, as a nurse, nurses are born teachers. I, as a nurse, will give you as much information as I can in the time that I have. Good? Questions? Great question. So now we're back to this. I know, it's been a long time, like a whole hour. But we talked about this. I told you that this is going to keep us safely in our scope of practice, right? we learned that the foundation is the care plan, the whole care plan, and nothing but the care plan. That's our foundation. That's where we stand. But then we got some walls because we have to keep ourselves in, right? We got a foundation, but then the world is wide open. We got to have some walls to keep us safely in our scope of practice. Now, one of those walls is CNAs do normal. And let me explain what that means. This is probably a topic of huge amounts of controversy. CNAs do normal. Now, what does normal mean? Normal means a routine task on a stable patient according to the care plan that the CNA has been trained to do. That's what normal is. A routine task. So bathing, dressing, vital signs, changing the bed, routine. On a stable patient. So the patient we just talked about who's having retroperitoneal bleeding, is that a stable patient? No. Okay. So keep that in mind. Okay. Routine task on a stable patient that the CNA has been trained to do. So have we been trained to take vital signs? Yes. Have we been trained to make an occupied bed? Yes. Have we been trained to feed a patient? Yes. Okay, so as long as it's a stable patient and it's a routine task, no changes, no bells and whistles, and the care plan tells us to do it, we can do it all day long, no problem. No problem. But the minute one of those changes, it is outside of our scope of practice. Okay, so CNAs do not help with codes. You ever watch a medical show where they call like a code blue and everybody comes rushing in and they put the paddles on and, you know, it's like mass chaos, people drawing blood and giving meds. Is that routine? Not for us. Have we been trained to do that? No, not for us. So are we involved in that? No, not for us. No. So CNAs do normal. Remember, you have to be trained to do something. But this is where so much controversy comes in. So let's say, let me pick on somebody new. What's your name? Gabrielle. So Gabrielle works in a same-day surgery center. Okay, so this is where you go in the morning, you have your surgery, you stay there a couple hours until you wake back up, and then you go home. You don't stay, you go home, right? Same-day surgery center. And she works in pre-op. So you're getting patients ready for surgery, getting them in their gowns, you know, all of that. And as the nurse, I come to you and I say, hey, Gabrielle, you've been working here a year. You're doing great. I'm really happy with your performance. I want to train you to hook up IV fluid so that once the patient's ready to go back, I put the IV in, but once the patient's ready to go back, you can start the normal saline before they go back. Now, our patients are not changing their routine. They're stable. And if I train you to do that task, it now becomes part of your scope of practice. So can you be trained to do that? Yes. Now, there are some caveats to this. Okay, there are some caveats to this. One of the caveats is your state has to allow that task. Now, I can't train you to put an IV in because our state says that's not appropriate for CNAs. But I can train you to turn the fluids on. Okay, good. Good. You also have to think about your employer, what they allow. Because the employer, let me explain liability. We're going to get to liability in a minute, but let me explain liability. What's your name?
Mahala.
Mahala. So, Mahala, let's say that you had a very bad experience in a hospital, okay? And you want to sue somebody because it was bad. Now, you could sue the CNA, but CNAs make what, 20 bucks an hour? You know, you're not going to get much. You could sue the nurse, and the nurses make about double that, but you're still not going to get much. Who do you think you're going to sue? Who's got the deep pockets here? A hospital, sure. So the employers have the most exposure, the most liability. They're the ones that are most likely to get sued from the actions of their employees. Make sense? So the employers are going to dictate what you can and cannot do in their facility, what they are willing to accept liability for. We call this a policy and procedure manual and a job description. Anybody ever hear of a job description? If you work, you should know your job description wherever you work. If you work, you should know where your policy and procedure manual is wherever you work. Every employer has to have a job description and a policy and procedure manual. It doesn't matter whether you're flipping burgers down the road or you're a CNA at the hospital, there's still a policy and procedure manual. If you don't know where it is where you work, you probably ought to find it, because that's the only thing that covers you. You should be familiar with it. So everybody go with that? You understand that? So your state law will dictate what is allowed for your modality, your title, but your employer will also dictate what they allow. Good? Makes sense? Makes sense? So that's the nurse's responsibility. So if what's your name? Antonio. So if I am the supervisor of Antonio and I want to train him to do something that he didn't learn in CNA school, I have to know what the law allows and what the facility allows before I train you on that task. But I can train you. Nurses can train CNAs to do additional tasks as long as the law allows it and the facility allows it. Make sense? Okay, but it still has to comply with normal. Routine task, stable patient, according to the care plan, you've been trained. Training can be at the bedside. It doesn't have to be in a classroom. It can be at the bedside. But those 4 things still have to exist. Good? That's what keeps us in place. Now, do you think you should just put a tracheotomy in somebody who's having trouble breathing because you saw it on, Grey's Anatomy? What do you think? Do you think that holds you in your scope of practice? No. So remember, routine task, stable patient, according to the care plan, we've been trained. Good? Now, on the other side, we got another wall. On the other side, we got another wall. Now, this wall is called Principles Guide Performance. Okay, so we're going to follow the care plan. Care plan tells us how to walk a patient 10 steps, ambulate a patient 10 steps. Okay, care plan told us we're going to follow the care plan, the whole care plan, nothing but the care plan. This is a stable patient, so it's normal. Okay, so we've covered that base. So now, how do we ambulate somebody 10 steps? So what are the rules involved? What do I need to make sure I'm doing properly to make sure that I'm in my scope of practice? Remember all those banners I just showed you? Those are your principles. We have to learn those because that creates the barrier. So if we're going to wash something, hand, a foot, a body, doesn't matter. If we are going to wash something, we're going to check the water temperature first to make sure it's appropriate. And we're also going to have our patient check it. That's a principle. Good? So we still have to learn those. But it tells you how to do every single skill. You learn these principles, and it puts you firmly in your scope of practice. We do what the care plan says on normal patients the way we were trained. That's our scope of practice. That's what a CNA does. Now, above it all, we have a roof. Roof is probably the most important. Okay? Keeps us from getting stuff falling on our heads. So our roof is that it's always about the patient. Because you will get so caught up and down here, what you have to do. You will get so caught up down here that you'll forget to look up and see that you're doing this on a real live human. This happens during the test a lot because you're focused on your task. your steps. I want to pass. Me. I wanna. Who should you be focused on? The patient. That's the hardest thing I have to do with you guys in 4 weeks. This stuff is easy. What I'm teaching you now is easy. It's getting you from steps. I have to do this and this and this and this, and oh my gosh, I forgot that, and how am I going to remember all my supplies? Me. I have to get you from that to paying attention to the patient. Now, if I'm successful in my job, you won't even know that I've done it. But if I'm successful in my job, that test will become super easy for you because you will treat that patient like you would want to be treated. And that will cause you to pass the state exam. Now, the other part of the roof is the most important job that we have. And that's to report all observations to the RN. Now, if you remember these 5 things, we follow the care plan, we do normal, principles tell us how to do it. It's always about the patient, and we report everything to the nurse. You know those 5 things, and you will be the best CNA in the country. And you'll pass the test. Good? Not hard, right? You only need to know 5 things to be a CNA. Those 5, whoops. And we've already covered them. So I got 3.5 weeks with you to go over this right here. We've covered everything else. We've built our scope of practice. All we have left to do is one wall. Easy. Good. See how easy this is? All I gotta do is stay reasonably awake. We're good. Okay. So we just talked about this. This is delegation. I have a video for it. Delegation just means that as the RN, I'm responsible for every task. If the patient needs foot care, that's my job. As the nurse, my job. If the patient needs to be fed, that's my job. As the nurse, my job. If the patient needs to be assessed, that's my job. As the nurse, it's my job. Well, unfortunately, with patients coming and going all the time, and I'm the only one that can do the assessment, I need some help for somebody to toilet patients and feed patients for me to free me up to do the tasks that only I can do. So what I need is a helper, somebody that I can say, hey, can you go do this the way I want it done? Because remember, it's my job. I'm just going to ask you to do it for me the way I would do it if I were doing it. That is why it's certified nursing assistant. Our role is to be the stand-in for the nurse on routine tasks, stable patients, according to the care plan. You understand your role? Good. I can delegate other tasks to you, but you have to be trained to do them. Now, the problem is I don't know who's been trained to do what. You guys have all worked in different places. I didn't hire you. Some corporate person in St. Pete hired you, stuck you with me. I don't know you. I have no idea what you do and don't know how to do. So if I ask you to do something, hey, can you go take a catheter out in room 212, and you've never been trained to take a catheter out, what are you going to tell me? Yeah, I haven't been trained to do that. No, not me. If I ask you to go take a fasting blood sugar on room 314, what are you going to tell me? Don't know how. Not trained. It's no reflection on you. It's no reflection on me. I don't know what your level of ability is, and the CNA I worked with last week was able to do those things. So if you haven't been trained, tell them. But be open to training. It will make you a much more valuable CNA. A word on that, though. Time out. This has nothing to do with class. A lot of CNAs, students, will take a CNA class, get certified, and then they go off and they take phlebotomy and they take EKG and they go get their med tech and they get their home health. They do all of these certifications thinking it's going to help them, and it doesn't. You've wasted a lot of time and a lot of money for no real gain. If you are working in an assisted living facility, phlebotomy, EKG, those are not going to help you a bit. They don't care. Those things are not done in that setting. If you are working in a hospital and you go take a phlebotomy class, you say, hey, I'm a phlebotomist. They're going to say, okay. And we have phlebotomists. I have a whole department of phlebotomists. What do I need you to draw blood for? Make sure that you know what the requirements are for the job that you're going for. Don't just accumulate a lot of certifications for no real gain. Now, if you're working on a telefloor of a hospital where all of our patients are monitored, then yes, an EKG class might be recommended, and they're going to tell you, if you get your EKG, you'll be more valuable here. But if you're working in mother baby, the EKG isn't going to help you a bit. Swaddling class will though. So make sure you're matching up future certifications with the work environment you're trying to get into. Does that make sense? A lot of CNA, and I see this all the time. They take all of these certifications and then they can't find a job and they don't know why. Or they find a job and they're not getting paid anymore because they have these extra certifications that they don't need. Good? Just a little soapbox rant. Okay. Let's answer Tatiana's question. How long has everyone here been trying to be a CNA for? I'm 19, will be 20 in February, and I've always dreamed of becoming a CNA. So how long have you guys wanted to be a CNA? Anybody want to answer that for her?
2 years.
2 years, okay. All right. Anybody else?
4 years.
4 years, okay. All right. Anybody take care of family members and it kind of sparked a love of, yeah, a couple of you. Okay, okay. Anybody have family in healthcare and just decided that, hey, that looks like a good opportunity. I got to work, you know, got to pay bills. Might as well be that. How many of you guys are here just because you need a job? Anybody? Okay. So the number varies. My oldest student was 76 years old when she came through my class. And she went on to work as a CNA. I also have taught high schoolers as well that had to wait a year before they could take the test because you have to be 18 or have a high school diploma to take a test. So I've taught every aspect of the spectrum. But good for you, Tatiana, for pursuing your dream. And Prince says, hi, ma'am. I'm one of your online students from Dubai. You're doing great, and I can't wait to join the physical class. Well, thank you and welcome. All right. Told you we have an international crowd. Pretty cool. Pretty cool. All right. So remember that delegation is decided by the nurse. So this is your biggest takeaway from this. If you think in your mind, am I allowed to do blank, right? Am I allowed to do blank? We always go back to our scope of practice. Is this a stable patient, a routine task? Did the care plan tell us to do it? Have I been trained? Do I know how? And that answers your question for you. Good? Good. You have no liability here. None. Zero. Zip. Zilch. None. No liability. As long as you are under your scope of practice. Right? Remember those 5 things we just talked about? As long as you're under your scope of practice, you have zero liability. Nobody is going to sue you. You are not going to have any sanctions. You won't get called in front of the board to Justify your actions, nothing. No liability. You want that. No liability. But it only occurs if you're under your scope of practice. If you know something that you did not tell the RN, are you under your scope of practice? What if the patient complained of back pain, you put him back to bed, and you did not tell the RN? Are you liable? Yes, because you did not tell the RN. What if you go to walk a patient, care plan says gait belt, but you decide not to use the gait belt because you can't find it? Are you covered? No, you are now liable. That patient falls, who's on the chopping block? You. The only way to remain free of liability as a CNA is to make sure you understand your scope of practice and you are operating firmly within it. That's why you need to know those 5 things. Care plan, CNAs do normal. We follow our principles to do the skills. It's always about the patient, and we report everything to the nurse. You do those 5 things and no liability will ever come back to haunt you. Okay? Good? Easy? All right, we're going to take a quick break. Let me get my paper here. We're going to take a quick break because I have to. So we're on 15. And if you smoke, please make sure that you put your cigarette butts in. There should be a bucket out there. Don't put them in the parking area. Okay. Bathroom's back there. And snacks, drinks, knock yourself out. I'm going to, actually, I'm just going to mute it. That'll be better. I'll mute that. And we will come back in 15 minutes.
Thank you.
My name wasn't on there.
Okay, your counselor had said that you were going to delay until the February class. So that's why I didn't have you
Okay.
on here, but that's fine. We'll put
Okay.
you in.
So I don't have any problem with the payment either.
Well, yeah, I'll get with her on that.
Okay.
It's fine.
Well, they're not doing it, so I'm going to do it.
Oh, okay.
So,
So you want me to invoice you then?
sure. So
Okay.
Okay.
I'll just send an invoice to that email.
Okay.
Okay.
All right, thank you.
You're welcome. Sorry about the car sounds, guys.
Thanks for the drinks and the snacks. That's real nice.
Oh, yeah, that's Julie. I really appreciate her.
Yeah. Who's Julie?
Julie is she actually had, this is her classroom. She
Oh, yeah?
does CPR in here.
Oh, yeah.
And she was nice enough to let us come in and make it our home too.
Wow. So, really
Yeah, we'll talk about CPR in a little while.
So bad. I went to Ivy camp and it was I did so bad. It was because I had to. I had to just go. I did. I had to. He said, just register, just go, and then I'm gonna go to another one for on the 24th. Yes, and I'm going to another one for freaking Stetson University.
How just committed.
Mm-hmm.
I didn't want to go to the meeting because I wasn't doing anything. Let me know why I committed those two and he decided to do it 30 days ago.
Yeah, that's what happened. Yeah, I went into their nursing program, but I don't know if I want to I don't know if the community route is better and then just go to community school and then work. It did. Should be closed. They're all doing that. But the moment when you text me, remember, I texted him and was like, I'm not committing anymore. I was like, yeah.
What about
I don't even know when to play soccer. Like, it just seems so much. Because I did the whole day, like I did how they would do it as a student. You have to wake up 9 in the morning, 2-hour session, you get a 2-hour break, and then back 2-hour session. And it was like, do that every single day for the next 4 years. Your butt in. Like, I don't know if I can do that. And in community college, it's the same thing because it's D2 level 2. And it's like, I want to get my degree, but I'm not going to be a soccer player. Like, if I was a soccer player, I would have been a community college. But the community college said, I'm going to be able to afford it. He's not getting scholarships. Or anything for community college. He's not getting scholarships.
Because they only break up 6 and 7. So kind of confusing how it really breaks down. Because everything is a lot more complicated, but I think
If I can work at like a hospital while I'm doing, because like if we're doing, because I already got into like soccer teams, like I already like University of Minnesota, University of California, and then now I'm like, I don't know what's the best option because it's like soccer or
I
not
just
just like
research things to whatever comes to
things, yeah. And it's like I'd rather just like work instead of playing soccer. You know what I mean? So bad with the stuttering. I got it small. Someone gave me a large. I think a large order. Yeah, it's like a small. Everything never feels small. So I got fired. Can't I didn't tell you that? Not even care.
I was looking at this, she would have just been like,
She was not going back. I'm sick and tired.
when you told me about fire, I was like, oh my god.
That was so funny.
And then more she got fired. I knew I was fired. I knew I was get fired too. No, no.
Okay, we're gonna get started again. Everybody ready? Good? All right. So let's talk a little bit about the state exam, what to expect on the exam, how it's structured, kind of demystify the exam. So again, I have a whole video on this that you can watch in the animated lessons area. But there's 2 parts to the state exam. There's a written test and there's a clinical skills performance test where you're going to have to demonstrate 3 clinical skills. Now we're going to learn 20 here, plus hand washing. We're going to learn 20 actual skills, and you will have to demonstrate 3 in front of 2 RN evaluators here in Florida. We have 2 evaluators. So we have 3 skills, 2 evaluators, 1 test. There's also a written part of the test. We're going to talk a little bit about that in a little while, the written exam. But this page 12 kind of tells you a little bit about the test itself. We are going to, I'm going to pass out the packets to register for the test at the end of next week. You can actually see it on your syllabus. So next Wednesday, not this Wednesday, next Wednesday, we'll go through the whole test registration process. There's 2 ways to register. You can either mail that packet in. That's okay. It's kind of the slow boat to China, but you can do that. Or you can take that packet that we fill out together and you can use that to register online, because the online application is exactly the same. You just take what you wrote in here and you transfer it to the online registration. We'll talk about that next Wednesday when it comes to testing time. So on testing day, you're going to go to a testing center. Here in Florida, whoop, I told you, I am going to end up, because it's gray and it blends in. I need to get a red USB cord so I don't hurt myself. Okay, so on testing day, you're going to go to a testing center. Here in Florida, These are our testing centers. That's it. This covers the entire state. That's it. Okay. Our closest testing center is in Tampa. We used to have one in Newport Richey. We used to actually be one years and years ago, but they stopped using testing centers in small locations. They consolidated them to larger areas. So our closest testing center is in Tampa. On testing day, you are going to be there with 7 complete strangers. You will not be testing with the people in this room. Everybody registers independently. So you will be there with 7 complete strangers. This is not the day to make friends. It's not. I'm going to be very honest with you. And the reason that I say that, why it's not the day to make friends, is because you're going to be nervous. You're there to test. So are they. And when you are sitting in that waiting room, waiting to test, you guys will all start talking about the test. It's natural because you're about to go in and test. And the conversation will go something like this. Oh my gosh, I really hope I don't fail. My teacher said that you have to use 7 paper towels when you wash your hands. And what if I forget? Oh my gosh, what if they don't have enough paper towels? And somebody else is going to go, 7 paper towels. We were told 10. And somebody else is going to go, we weren't told to count at all. It's just whatever you need. And now you're about to go in and test. And now you don't even know how many paper towels to use when you wash your hands. So what do you think is going to happen to your confidence level? It's going to go straight down. Now, there's another part of this that I really hesitate to talk about, but it does need to be said. I told you that we are the #1 channel for CNA. Everybody that's there has watched our videos. Everybody. They all have seen Miss Patty. And when they find out that you actually went to Miss Patty's class, you met Miss Patty, you sat in Miss Patty's class, you will get celebrity status. And it's funny, but you will come back and tell me, oh my gosh, it's funny, but it's not funny. Because if you then chime up and say, well, Miss Patty said paper towels don't matter, okay, and they go in and they fail, who are they going to blame? The last person to give them information. And by the way, paper towels do not matter. Nobody cares. But there are some instructors out there that overcomplicate all of these processes on purpose to make themselves seem more knowledgeable. I'm all about simplifying this. I want this as easy to do as possible so a 9-year-old can do it. That's my goal, is to make this so simple a 9-year-old can do it. Guys, we're brushing teeth. I mean, really. I want to make it simple. I don't need my ego stroked. But there are some people out there that do. And they will overcomplicate these skills and make them almost impossible to remember. That doesn't do you any good. But what it does is it confuses the students. And then they're very unsure going into the test. I don't want you to get wrapped up in that. That is not your role. Your role is to go in, to test, to be successful, and go out there and tell the masses. You can tell everybody in the world how to do the skills after you test. I want everybody. I'm all about free education. You did not have to pay money to sit in this classroom. You could have joined online for free. But you wanted to be in a classroom. You wanted hands-on learning. Well, I have to charge you for that because I have bills, right? But this information is free. So go out there and tell the world. Teach everybody what I've taught you. That's fine, but don't do it on testing day. protect your confidence level. La, 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 la. Don't listen. I want you to be confident. Good? Good. Now, the evaluators will probably look at you and go, yeah, you went to Patty. The way that I teach you to do the skills is very, very specific. It's easily identifiable. But here's the other part. I've been doing this in this community for 18 years. I've been teaching CNA in this community for 18 years. The people that are going to hire you, I've got over 5,000 graduates, guys, right here in this county. The people that are going to hire you probably sat in my classes when they first started. Over half of the CNAs that I've trained have gone on to be RNs. I have roughly, last I counted, 15 or 17 that are now nurse practitioners. Started as CNAs, right in the classroom that you were taking. I have one who just recently got her doctorate in nursing. It's possible. You can go with this as far as you want to go. But those are the people that are hiring you. So when they find out that you went to Miss Patty's class and you perform the skills the way I've taught you to perform them, it is going to speak volumes. It will also speak volumes in the test. So you don't have to have any faith in you right now. But you do need to have some faith in me. Okay? Good. I will get you through the test. If for some reason you do not pass the test, you need to come back and talk to me, and we're going to find out why. We are going to find out why. Because my students do not fail the test. They don't. Okay? There's no pressure on you. That's all the pressure on me right now. But you will have to practice. We're going to talk about that. So on testing day, we're going to go to a testing center. We are not going to make friends. Our closest testing center is in Tampa, and there's only 3 things that you're allowed to bring into the testing center with you. Your test admission letter, which looks like this. If you can't print it out, no problem, but this is what it looks like. This is your test admission letter, right there. You can bring your keys in with you. And you need to bring 2 forms of ID. One, non-expired government ID with a picture. So driver's license, state ID, or passport. Military ID. You also need a secondary ID, has the same name, but has a signature. So a debit or credit card, voter's registration. Do we sign? Yeah, I think the voter's registration is signed. Library card will work. Social security card is what most people use. So one has a picture, one has a signature. Names have to match. How many of you guys have more than one last name? Do I have anybody in here with more than one last name? Okay. Pay very close attention. Your IDs have to match. Okay. We usually run into that when people have like 4 names. I actually had somebody in here with 5 names once, and I'm like, I don't even know what to tell you to do with that. Not sure. But do you know what's not on here? A cell phone. You are not allowed to have a cell phone during the test. From the time that you check in until you leave, you cannot have your cell phone. Not in the testing center. So you can leave it in your car. We're going to talk about that in a minute. But if you take it into the testing center, they're going to make you put it in a locker, and you're not going to have it at all during the test. The other thing that's not up here is study material. Can't have it in the test. So you are sitting, and this is why it's a problem. You are sitting in a waiting room with 7 other strangers and nothing to occupy you. Don't make friends. So let me explain how this works. There is something you can do. I'm going to talk to you about that in a minute. There is something you can do, but don't make friends. All right. So when you go in, you're going to go into a waiting room. There's 2 rooms that are off at some other place, right? There's one that's the clinical skills room, and there's one that is the computer room for the written test. So when you are in the waiting room, you can't see other people testing. It's separate. So when it's your turn to test, you are not testing in front of other students. It's just you, your patient, and the two evaluators behind closed doors. So you're not on a stage performing in front of hundreds. Okay. When you go into the test and it's you and 7 strangers, they are going to check you in. When they check you in, they're going to ask you, do you have any conditions that would keep you from being a patient for any of the skills? So if you've got a raging athlete's foot infection, you probably ought to let them know that. If you just had some dental work done and you saw stitches, you need to let them know that. If you're allergic to milk, you need to let them know that, because feeding is one of the skills, and we use either pudding or applesauce as our feeding item. So you need to let them know if you have a condition that would keep you from being a patient for any of the skills. Let me tell you a really funny story about this. Now, this is why I tell this story, because I didn't used to, or why I tell you this. I didn't used to. Many, many years ago, I had a student in class who had a prosthetic leg. She had been in some sort of an accident, lost her leg, and she had a prosthesis. I had no idea. You guys are all in scrubs. I'm not inspecting your bodies. I don't know what body parts you have and what body parts you don't. I didn't know. She goes into the test. She did not tell them that she had a prosthetic leg. Didn't know she was supposed to. So she was a patient for one of the skills, and the skill was range of motion of the leg. So the person being tested, remember, this is a test, goes to lift her leg, and you expect a certain amount of weight. That's not there with a prosthesis. So she put her hand under the knee and a hand under the heel and lifted and took the prosthetic right off. Now, my student is laughing her butt off. She thinks this is the funniest thing in the world. The evaluator is about to lose it. And the person being tested did lose it. Dropped the prosthetic, broke out in tears, was absolutely just, I mean, you're scared, you're nervous. This is a big deal. This is a test. And she just didn't know. She thought she broke the patient. She just didn't know what was happening. So if you have something, please let them know, right? We don't want somebody in there brushing your teeth and all of a sudden you start spurting blood because you got a stitch there that somebody just broke loose. Don't make this harder on the person being tested. Does that make sense? But on the other side of this, don't try to get out of being a patient for one of these skills because you just don't like people touching your feet. And I'm going to show you why that's an issue. Okay, so be honest, but don't overinflate things to get out of being a patient. So when you go in and they check you in, they're going to pair you up into groups of 2. This is not random. This takes about 20 to 30 minutes for the evaluators to do. Not random at all. So let's say that 1, 2, 3, 4, 5, 6, 7, 8. So you 8 are here to test. Okay? I'm not just going to pair you up because we have to make sure that depending on what skills you get, that the person that we're pairing you up with is adequate for that skill. Make sense? So let's say that you have transferring from bed to wheelchair. Now I got to find somebody about your body size or smaller. I can't pair you up with somebody that is larger than you for that skill. So I'm probably going to pair you up with her, right? That would be a good match. The problem is that she has mouth care and you just told me that you got some stitches in there. So, I'm back to the drawing board. Well, you might be an okay substitute. So do you see how this could take some working for the evaluators to figure out who to pair people up with? Now, if you go in there and you start making things hard, I'm not going to be a patient for foot care, for mouth care, because you don't want to. That's really going to put those evaluators in a bad mood. Now, let me tell you something about evaluators. They are all RNs, usually nearing the end of their careers. They're not wanting to be where they are. They want to be at home in their pools drinking their margaritas. And you are what's standing in their way. Because it's not like a hospital job where you have to be there from this time to this time. No, they get to go home when you guys are all done. So what do you think they want to do? Go home. Who's standing in their way? You. That's right. So if you make this too terribly difficult on them, and you make them stay there longer than they want to stay there, they are not going to be happy campers. And they are responsible for your grade. You want them to be happy campers. Good? You want to go home too. You want to go in, get your test done, and go home. You don't want to be there. So let's all play nice, and we'll get this done quickly, and everybody can go home and do what they want to do. But don't make this difficult on them. Good? Make sense? Okay. So once they have you paired up, so I'm going to put you with you. I'm going to put you with him. I'm going to put you with you. Okay. You guys are now paired up. And see, it's not random. There's a reason that you guys are in these groupings. So when they have you paired up, they're going to take the first two people, the first pair of people into a room that has a bed, has a shelving unit with all of your supply, has a whole bunch of stuff. And when you go into the clinical space, the evaluator is going to have a care plan set. Remember, you've got these, right? Have a care plan set. They're going to read it to you because they can't even trust you know how to read. And then they're going to hand it to you. And that is yours throughout the entire test. You can go back and read this at any time you want to. Let's say that you are halfway through your first skill. You got gloves on. And you can't remember what you're supposed to do. You can stop and go over and read that care plan if you want to. But don't touch it with your gloves. Right? So even though we can review that care plan, we don't want to contaminate surfaces. You can take your gloves off, wash your hands, and then touch it. That's fine. But infection control is going to count here. Does that make sense?
Is it double-sided?
Actually, this is what the care plan looks like. I've given you little cards so that you have them, in your kits. But this is actually what they look like. So everything is, you can see it here, there. Everything is on one page. This is what they look like. Now this is always in here. It's up there. You can play with this on the back. That's the actual checklist that they are using to grade you. That is the actual checklist that they are using to grade you. And you have access to this. Now the problem is that this is written for RNs. Are you guys RNs? Probably not going to help you a whole lot. What you need is an RN to read this, filter it through an RN brain, and spit it out in a way that a CNA can understand it. Because you aren't going to know if you violated an infection control policy. But I would. That's what I've done for you. These are the steps you're graded on. But I'm going to show you what I'm going to give you, or what I have given you, is an adaptation of this in a format that you can actually use. Okay?
Do you do 9 steps?
What's that?
Do you do 9 steps?
Oh, no, there's way more than 9. Yeah, we're going to talk about that. Yeah, way more than 9. But don't panic. All right. So this is the care plan set. There's 11 of them. You will get one of those 11. You've got the short version on the cards here that you can play with. You've also got this version up here that you can look at. I sell these on my website, but you don't need this. Remember, you have this in your book. You've got the care plan cards. This is more for instructors. But you need to know that it is there. Every care plan set has 1 ADL skill, 1 documentation skill, and 1 mobility skill. So these care plans actually follow a formula. 1 ADL skill, 1 documentation skill, and 1 mobility skill. So There's only 4 documentation skills. You're going to get one of these 4, guaranteed. You will either have to take a pulse, or you're going to empty a urinary drainage bag, or you're going to feed a patient, or you're going to count their respirations. You will get one of those 4. It's a guarantee. But you're also going to get one out of that category and one out of this category. Now, these sets are already predetermined. There's 11 sets that they use. You have access to all 11 in the cards and on page 25 in your book. So when you are testing, they're going to grade you using this checklist. Now, Prometric has a checklist on their website that anybody can get. You can go download their checklist. That's fine. That's allowed. You are allowed to have access to this checklist. The problem is the one that they give you is not the one that they use for grading. Because the one that they use for grading has something called indirect care built in to the checklist. I have put those together here to make sure that you're getting all of the steps that need to be done. And I said I'm a Prometric test specialist. This is what I mean. I know a lot of the back end hidden parts of the test. And that's what I'm using to create this program to help you guys be successful. My students don't fail. You guys are going to be good. All right, so you go to the test. You get paired up with another testing person. You're taken into the room. The evaluators show you around how everything works, where everything is located. They pick one of you guys to go first. They hand you your care plan set. They read it to you. It is now yours throughout the test. You are then going to start your test. You're going to take a few minutes to kind of digest it, breathe, and then you're going to tell them when you're ready to start. Don't take forever. Where do they want to be? At home in their pools, drinking their margaritas. Don't take forever at this. And then you're going to start your skill. You are going to do your skill on another testing candidate. They are going to be your patient. When they are your patient, they get a script. They can't just do anything they want. They get a script. They are going to be pleasant. They are going to be cooperative and say yes. And most importantly, they are going to follow the directions the evaluator gives. So if the evaluator says only take 4 bites, how many bites you taking? 4. If the evaluator says, hey, slouch down in that chair, what are you going to do? Slouch down in the chair. Okay? That they do not make this hard. They do not have you spit food across the cafeteria. They don't make anything. This is entry-level skills. Think way down here. Now, when you go home and you start practicing on your live people at home, try to find live ones, dead ones won't help you. You start practicing on your live people at home, they are probably going to do stupid stuff like drool or be difficult or say no or anything like that. That is not your patient at the test. Tell them to knock it off. Tell them Miss Patty said knock that off. That is not helping you at all. You need to be in kindergarten before we graduate to 12th grade. Okay? So they need to be pleasant, cooperative, and them. Now, this is the other part that just kills me with family. They will do something like this. Ugh. Right? They try to win an Academy Award. Oh. How many of you guys have ever been a patient? Are you old? So that means that patients are not always old. Patients can be babies. Patients can be children. Patients can be teenagers. Patients can be middle age. And yes, patients can be old, but are all patients old? Tell them to knock that off. We're not going for an Academy Award. Be them. So if you are walking somebody, they should walk like they walk. Right? Right? They shouldn't try to turn into a 9-year-old invalid. If you are feeding somebody, they should eat like they eat. Good? Good? Miss Patty said. So when you are performing these skills on another testing student who has received instructions, the evaluator is going to use a checklist. And when you do a step, you get a check mark. If you don't do a step, no check mark. If you do a step wrong, no check mark. If you do it right, check mark. Anything without a check mark is called a deficiency. That's what's going to be entered into the computer for grading. Those evaluators do not pass you. Those evaluators do not fail you. Let me say that again. Those evaluators do not pass or fail you. All they are glorified clerks that put checks on a checklist when you do something correct. That's it. Anything you don't do correct goes in the computer, and the computer decides, based on what you missed, whether you pass or fail. And that's because these steps do not all count equally. They're weighted. Now, nobody knows the exact weights of anything because that's a tested secret, but they're weighted. And let me explain what I mean by that. How many of you guys have ever brushed your teeth? Good. So you're kind of familiar with the process, right? Okay. What position are you in when you brush your teeth? Upright, right? Would you brush your teeth laying flat in bed? Why? Dangerous. You could choke. Absolutely. Absolutely. So do you think it's kind of important to make sure that the patient is in an upright position before we start brushing their teeth? Pretty important, right? Okay. If you fail to do that, the patient could have some pretty serious consequences, like they could die. Now, I don't know about you, but when I brush my teeth, I'm kind of leaning forward a little bit over the sink because I get this whole big foamy mess thing going on, and it drips down a little bit. And I don't want to be standing like this because then it would drip all over my clothes, and that would just make a mess, and I'd have to change, and that's a whole nother issue because I don't know what I want to wear today. So I bend forward to brush my teeth so that everything goes down. Good? Everybody with me? Okay, but if we get a patient sitting in bed and we put that bed up, they are not leaning forward, are they? They're kind of sitting like this, which means that all that big foamy mess is going to go right onto their clothing. So what could we maybe put on their clothing to help catch any of that big foamy mess? Towel. Towel would work perfect for that. So when we brush somebody's teeth and they're laying in bed, we want to put the head of the bed up and we want to put a towel over them. But do you think anybody has ever died from getting toothpaste on their clothing? Probably not. So we have two steps that we know should be done. Head of the bed up and towel over the chest. They're both kind of important, but which one do you think is more important? Head of the bed up. So it's going to be weighted more. If you don't put the head of the bed up, you're going to fail because there's a very negative consequence to the patient. If you forget the towel, you forgot the towel. It's going to count against you, but it's not going to be life-altering. Do you guys understand that? So every step is going to be weighted. Now, a question I get all the time is, well, how many steps can I miss and still pass? Well, I don't know. What steps are you missing? Let me give you a really big hint here. Really big hint. If the care plan says something and you miss that step, that is going to count really big. Because if it's on the care plan, that means it's important. Does that make sense? Yeah. So do you know the whole first hour when we talked about the follow the care plan thing? That's why. Because deficiencies that are based on the care plan are serious deficiencies. Good? So I can't tell you how many things you can miss and still pass, because it depends on what it was that you missed. But I can tell you that if you're my students, you should not be missing anything. And when I'm done with you, you probably won't. But let's talk about this. All right, so we have this deficiency here. And when we finish our skills test, the evaluator is going to take all of those deficiencies, put them into the computer, and the computer is going to decide, based on those deficiencies, whether you pass or not. So then you're going to get, at the end of the test, something like this. This is a test report. Now, at the top, it says, test results, candidate passed the clinical skills test. That's what you want to see. Candidate passed the clinical skills test. Down here, it's going to tell you the skills that you had that were on your care plan. It's going to go over into the next page. Why they can't put it all on one page, I don't know, but you will get a second page that looks like this. And then you're going to get this page. This is the most important page on the test because this tells you all of those deficiencies, everything that wasn't checked off is going to be listed here. If it's only listed once, it did not count against you. If it's only listed once, that means only one evaluator counted that as a deficiency. The other one said it's good. So because they don't agree, you get credit for it. But if something is listed twice, it counts against you. Now, that means both evaluators, and they're supposed to grade you independently. They're not supposed to collaborate. They're supposed to grade you independently. That means both evaluators said you did not do this step correctly. Why do I think this is the most important page on your test results? Because if you remember me saying earlier, you're preparing for the test. I'm preparing you for the day after the test. When you go to work on live humans, if I'm the body in the bed, do you think I want a just good enough CNA? Do you want a just good enough CNA working on your family? Do you want somebody who's committed to excellence working on your family? When you get this, you need to read this, and you need to look at this as an opportunity for improvement. Just passing the test is not good enough when it comes to my family. I want CNAs that are committed to doing everything perfectly when it comes to my family. More importantly, when it comes to me. Right? If you don't get this page, you get a gold star. You got a perfect score. Okay. So, once you are done with the clinical skills test, you go back out to the waiting room. So, what was it? You two were, hold on one second. You two were group one. You came in. You did your skills on her. She did her skills on you. You went back up to the waiting room. You guys were group two. You did your skills on him. He did his skills on you. You went back up to the waiting room. You guys are group three, and so on. Right? When everybody is done with the skills test, then usually you go into the written test.
So if we don't get those, that means we didn't pass the test?
No, if you don't get that page, it means you got a perfect score.
Okay, if we don't get it, if we get it, that means we don't get it.
No, it depends on what you missed. It depends on what this is as to whether you passed or not. But it will tell you at the top of the page whether you passed. But what determines that is what this is. If you didn't put the head of the bed up when you were brushing somebody's teeth, you failed. One step, failed. Why?
Negative consequence.
Negative consequence to the patient. That's exactly it. Does that make sense?
Yeah.
Okay. So then you go into the computer room and you're going to take a 60-question multiple choice exam. You have 90 minutes to do it. How many of you guys just got anxious?
I just did.
Do you know why? Do Do you know why you got anxious? Because you've had written tests before, and you probably had a negative experience on a written test at some point in your life, right? So you're familiar with this. You know what this is. You know that a written test is scary because you've had experience. You should not be. Are we allowed to think? Are CNAs allowed to think? No, this is not a hard test, guys. I will make sure you pass this. This is not hard. This is easy. The test that you should be afraid of is the skills, the practical. But most of you guys will skip right over that. You'll start stressing this because you've had experience with written tests. You don't know to be afraid of the practical because you haven't had a practical test. You don't even know what to expect. So you just fly right past that and you go straight to, I'm going to stress about this because it's in your realm of experience. Don't stress this. This is easy. We follow the care plan. Report everything to the nurse. We follow our principles, which we still have to learn. This, easy. This, I can tell you, breaks down into 5 things. 5 things. Number 1, know your role. Know your role. What are we?
CNA.
CNA. What defines the scope of practice of a CNA? We follow the CNAs do normal. Principles guide performance. It's all about the patient, and we report everything to the nurse. Yeah, that's your role. Okay, so you already have that covered. You know that. I can give you any question in the world on your scope of practice, and you guys would be able to answer that now. Right? Right? So know your role. Second thing you need to know is know your normals. Now, we still have to learn this. Normals is not just normal vital signs. Normals is also what's normal for the patient. Right? We all have different preferences. Some of you get up and go straight into the shower. Some of you get up and have some coffee first. Some of you shower at night. Right? We all have preferences, don't we? So what's normal for the patient? But we also need to know what's normal for aging. And we're going to get into that as we get through this program. But know your normals. You're going to have some questions on that. And what to do when normal isn't normal anymore. Right? What do we do with that? We also need to talk about safety. Now, your yellow book is going to cover a lot of that safety. That's why we still have to read it. It's going to cover a lot of that safety. But safety is always in the details. And we're going to learn details. Okay, good. So know your role. We've already covered that. Know your normals, safety. And then we get into 2 other things that we're going to talk about coming up here. Patient rights. We're going to talk a little bit about patient rights today, but we're going to talk about it throughout the program as well. Patient rights and infection control. Now, I've got a long way to go with you on infection control. I've got to challenge some of your beliefs. We're going to do that on Wednesday. You're going to leave here a different person on Wednesday than you came. I'm going to change some fundamental beliefs that you currently hold. But I've got to do it in a very specific way that makes sense. Good? Good. Those 5 things. Know your role. Know your normals. Safety, patient rights, and infection control. Those 5 things makes up the entirety of this exam. That is what they're grading on. Now, those of you that are a little bit afraid of this, I have a game show that I do on the 1st and 3rd Tuesday of every month. Tomorrow will be this month's, where I go over 15 test-like questions. And it's on YouTube, and you put the answers in. 1, 2, 3, or 4. So I read a question, you answer it, and the program that I use keeps track of all of that, awards points, and I give the top 3 people real prizes. Now remember, we only do prizes nationwide, but people tune in from all over. So this is a really good way for you to practice for that exam and have the opportunity to win some pretty cool things, real things. So we do that on the first and third Thursday of every month at 11 a.m. So tomorrow at 11, if you go onto my YouTube channel, you guys can all participate as well and see the type of questions that you might get on the state exam. So if this is causing you anxiety, I would tune in. But you don't need to be anxious over this.
So the first and third Thursday?
First and third Tuesday. So let me borrow this. I'm going to go get a bright red cord. So everybody has this resources flyer. Right there, top middle, practice test game show. It tells you all about that practice test game show. The first thing there talks about the test coaching ebook. See this little blue book here? I have this in ebook form. I wrote this, and it goes over those 5 things I just told you about. Know your role, know your normals, safety, patient rights, infection control. It gives you some sample questions and helps you break down those questions so you know exactly what they're asking and how to pick the right answer. It is a workbook style ebook that walks you through everything on the written exam. So I have got lots and lots of resources for you, but just stay tuned, pay attention. I'm going to walk you through all of it. Good? Am I overwhelming anybody yet? Everybody still with me? Okay. All right, so this is the ebook that we just talked about. This is the only physical copy I have, so please don't take it. I had to pay to get this thing printed just so I had a physical copy of it. We give it to you in ebook format. So if you go to 4YourCNA.com/ebook, it's on your resources page there. Just put in your name and email address, and it gets emailed out to you. You just download it and you go through it. It's very quick, but I have had people that failed the written test twice, did this ebook, went back and took it and got 100%. It is seriously effective. Crazy effective. So it's worth your time. It'll take you probably 20-30 minutes to go through. Okay. So these are your test results. This is what we were just looking at here. Test results, it'll tell you whether you passed the written test. These are the categories of the test, how many questions are in each category, how many you got right. It'll tell you whether you passed or not. Another question I get asked a lot, how many questions can I miss? Well, ideally, none. I want you to be perfect for my patients. But it depends on the question that you miss. Now, let me explain what I mean by that. Each one of these categories, you have to pass each category. I can't have somebody who's like, yeah, she's a 10, but when it comes to safety, not so good, right? We need you to be up to date on all categories, not just a few. So if there's 9 questions in a category and you miss 5 of those questions, that means that you probably don't know your role. Should you be a CNA? No. If you don't know your role, you're going to be out there making decisions right and left. And who's going to suffer for that? The patient. So even if you know how to do the skills, you get all these right, but you don't know your role, you should not be a CNA. So you got to pass each one of these categories. But there's also, and the book tells you about this, there's also something called a critical concept question. This is a safety question. You will have 1 or 2 of these on your state exam. Everybody gets 1 or 2, and it depends on how you answer the questions as to how many critical concepts questions you get. The test is very, because it's on the computer, very adaptive. Good? Make sense? Let me explain to you what a critical concept question is, because most people don't even know this thing exists. These are questions that are written in a way that if you answer it wrong, it just counts as a wrong answer. But if you pick a specific wrong answer, it is an automatic fail. That specific wrong answer puts your patient's life in mortal jeopardy. Now, this usually has to do with fire safety. So with fire safety, your yellow book is going to train you what to do in a fire safety situation, but it's always RACE. Rescue, alarm, contain, extinguish. So number one action is rescue. We remove patients from the fire. Patients and fire should never be together, ever. So your first action is remove the patient. So if you pick an answer that leaves your patient in the same place as a fire, that puts your patient in mortal jeopardy. So it doesn't matter how good you do on the rest of this. In an emergency, you're going to leave your patient hanging out to dry. Does that make sense? You will have one or two, depending on how you answer stuff, critical concept questions that show up on the state exam. If you miss that, missing it is fine if you choose one of the wrong answers, but if you choose the answer that puts your patient in jeopardy, we call it the wrong answer, it'll fail the test. One question. But do you guys understand why? Right? Make sense? Because in an emergency, we don't have time. We don't have time to go ask somebody, what do I do? We don't have time to go look it up in the policy and procedure manual. We have to know. We have to act. So these are always emergency-based questions, critical concept questions. Good? Did I confuse anybody there? Okay. And then you get your response from your clinical skills test, tells you whether you pass or not, your skills listing, and then you get your deficiency report. Make sure you look at this. Opportunity for improvement. All right, so let me explain to you about this program. Like I said, I have been doing this a very long time. And my program that I was teaching 18 years ago is not what it is now. It has evolved over the years. And it evolved because I learned things from you, right? When I first started teaching, I taught my students, sent them out to test, and they failed. Well, I got to figure out why they failed so I can fix that so the next group doesn't fail. Thankfully, I've been through all that. You guys are good. But that's the process that instructors have to go through. Well, as I was going through that, I really did a deep dive into, these are called the clinical skills checklists, into the steps of the checklist. And I started to notice something that was very, very interesting to me. What I noticed was that the first step listed on every single checklist was exactly the same. All 20 skills. All 20 skills. First step, exactly the same. And I thought, that's weird. And then I looked a little bit further and I noticed the second step on every single checklist was exactly the same. And I thought, I might be able to work with this. I could work with this. If I train you to say a certain number of words in a certain order that fixes 1 and 2 and gets us credit for 1 and 2, we can do that for every single skill. So you learn it once, you do it nonstop, and we get 2 check marks. That sounds good to me, right? Less to learn, easy. So that's what I did. I'm going to turn this air because I know it's getting cold. I see penguins wandering. All right, so that's what I did. I looked at these checklists and I looked at the different similarities, all the steps that were the same, and I thought I can do something with that. Now, I'm a very colorful person. I don't know if you noticed, I'm a very colorful person. I like, and I went, because I know I was teaching you guys, I went kind of muted. Normally they're pink and purple and blue, and I'm colorful. All of these banners back here are colorful for a reason. Now, we've already learned skill rules, right? We perform the skill as on the care plan. We follow the care plan, the whole care plan, and
Nothing.
nothing but the care plan. While we're doing that, we should be observing. And who do we report those observations to? The nurse. So that's universal. That's always. That's for every skill we do, right? So skill rules apply to absolutely everything. But then we have the opening, green. Green. That's where we start, right? Green is always for go. Good? Go. So we've followed our skill rules. Our care plan told us what to do. Now we've got to figure out how to do it. And we want to get these things checked off. So step 1 and 2 is always the same. But then I started looking a little further in the checklist, and I noticed that this was showing up. Now it's different numbers based on the length of the skill. But I started noticing that this one line was on everything. Everything. Ask resident about comfort needs during care or before care completed. It was on every single checklist. Huh. So as I was developing this program, I put all of these steps that kept showing up on every single checklist. I put them all together and we called it the opening. So our opening is always done exactly the same. It does not matter what skill we're doing. Foot care, we do the opening. Feeding, we do the opening. Mouth care, we do the opening. Pulse, we do the opening. Every skill, we do the opening. You guys good with that? I'm going to show you why. I'm not going to show you why. Okay. Give me 2 seconds. Let me run out to my car real quick because I'm very visual and I think you guys will benefit from this. So give me just a second. I thought I had one in here. All right, guys, new place, still trying to get it all in order. All right, so let me show you what I mean. Somebody asked a few minutes ago if there were 9 steps or how many steps. And I want to show you this because this puts it all into perspective for you. So this is making an occupied bed. Okay, this is the checklist. These are all the steps involved in making an occupied bed. Do you see how many green ones are on there? Take a look at this. See how many green? Just making a bed. See how many green things are on there? See how many green? What about this one? A lot of green. Right. Well, maybe it's just this one. Let's look a little further. Now, what about this one? Does this have a lot of green? You guys see that? Green? You see all the green?
That's the middle place too.
Every single green is going to be checked off with the opening. The opening. So you learn this once, and every single skill, we're going to get 6, 7, 8 check marks out of it. One thing. You learn one, and you get like 6 check marks. Well, that seemed to me to be a pretty easy way to learn the skills. So everything that we're going to learn in here is a group of steps designed to get all the check marks completed. Good? Questions? It also makes it really easy to learn the skills. Okay, so our opening sounds like this. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to whatever, insert name of skill here. Now you can put it in your own words. I'm here to get your vital signs. I'm here to feed you lunch. I'm here to whatever. Or if you're stressed for the test, you can go, I'm here to feed a resident who is in a chair. There you go. Fine. Doesn't matter. As long as the patient knows what you're going to be doing with them, doesn't matter how you do it. I like to put it in words that they can understand. And then I'm going to ask them the most important question in healthcare. Is that okay? Is that okay? Now, why do you think I have to ask that?
Their consent?
Consent. Yeah. Consent. Why is consent important? I mean, they're in healthcare, and don't they have to do everything we tell them to do? What do you guys think?
They can sue you.
They can sue you, absolutely. What does no mean?
No.
No, absolutely. No means no. Does it matter what the roof looks like? No means no. So in this room, no means no. If I ask you to do something, you say no. No means no. So let me give you an example of this, because in healthcare, we seem to go off an off-ramp on this. We think everybody in our place needs to do exactly what we tell them to do, or there's consequences. And that is absolutely untrue. Right over here, I know you guys at home can't see this, but right over here, I have a whole banner on the resident rights. These are legally protected and enforced rights that your patient has. Legal. And they have the right to be treated with dignity and respect. They have the right to refuse treatment or care. That is their legally protected right. So we have to ask, is that okay? And if they say no, are we allowed to touch them?
No.
No, because no means
No.
no. But in healthcare, as a CNA, I have to follow the care plan or tell the
Nurse.
So if I tell a patient I'm here to do this and they say no, who do I have to tell?
The nurse.
The nurse. Do I have to kick up a fuss?
No.
No, I just say, okay, and I go tell the nurse. See, that whole process is already there for you. We're not inventing anything. Good? Make sense? This is why I lay this out in a certain way, so we all understand how this goes. Okay, so dementia is a little bit different, right? So with dementia, we generally, you're going to receive additional training if you're working with dementia patients, but this is what you're going to learn. With dementia, we generally don't say, is that okay? Or we don't give them a yes, no option. Now, this is why. Anybody ever see a 2-year-old? Anybody have any experience with a 2-year-old?
Yeah.
I love 2-year-olds. 2, 3, favorite age. I love 2 and 3-year-olds, and this is why. I know they drive parents crazy. Oh my gosh, that's why we call it terrible twos. Drives parents nuts. But this is what I like about them. They are determining that they are an independent entity. And they have no control over their environment. They have no control. They don't get to decide what time they go to bed. They don't get to decide, when they're going to go to school. They have no control over anything. They don't get to decide dinner. They have zero control over anything, right? But they're learning to be an independent entity. So if you ask a 2-year-old a yes, no question, do you know what they'll always say?
No.
No. Yeah, it's universal. They will always pick no. Do you know why that is? Here's some psychology for you. The reason that a 2-year-old will always default to no, unless it's ice cream, but they'll always default to no is because it's the only thing that they have control over. That is it. You gave them a yes/no question, they will always default to no because that is a control move. So you want to get along with a 2-year-old? Never, ever, ever give them a yes/no question. You give them limited choice. Do you want to put your shoes on now or after you get your backpack? Do you want to take a shower now or after your snack? Limited choice. That still gives them power without a fight. Now, when we have somebody who is unable to make decisions in their own best interest, we use the same modifying behaviors. So if I'm working with dementia patients, we don't use yes, no. We use limited choice. If I'm working with mental health that has problems processing their ability to determine safety or well-being, I'm going to use limited choice. We're going to guide them in the direction we want them to go, giving them some power, but not the power of no. But with dementia patients, if they flat out refuse, you still can't touch them. You need to take it to the nurse. I'm going to give you some very, very sobering trigger warnings here, okay? And I'm not going to spend a lot of time on this, but this is something that we need to be aware of. People with dementia, those with mental illness, those in our care that are vulnerable, that can't always refuse properly, that can't always see to their own safety, they are at risk. We call them at risk. We call them vulnerable populations. And the reason that they're vulnerable is because healthcare workers like us can take advantage of them. Now, this does happen. We had a young lady about 4 years ago who was in a persistent vegetative state, what we would call a coma, in her 20s, who was raped by an LPN and ended up giving birth. There is no way that consent was involved there. This was a vulnerable person in an at-risk situation that was taken advantage of. Now, if you think this doesn't happen, right up the road in Citrus County, we had one of the worst episodes of this right in our own backyard. There was a man an RN, who worked in post-op, what we call recovery room. And this is back when you would work alone. You only had 1 or 2 patients. You would watch them as they recovered from anesthesia. And he sexually abused at least 8 women while they were under anesthesia. And he was found out because a nurse walked in on him during an event. We have no idea how many others he sexually assaulted because they were under anesthesia. This happens. This happens. So if we have a dementia patient who was fine, and all of a sudden now you go to do pericare and she starts guarding and hitting and screaming and reacting, could that possibly be a sign that they were taken advantage of? So, should we ever touch somebody, no matter what their mental state, if they refuse? Who should we be reporting it to?
The nurse.
The nurse. Because it could possibly be a sign that something has happened. You guys understand that?
Mm-hmm.
I know, trigger warnings. It's a horrible thing to think about. It's a horrible thing to have to discuss, but it does happen. Now, on the other hand, your dementia patient may just be reacting to you. To you. Now, there's 2 reasons for this. Number 1, personality difficulties. There are people that I just don't like. I might be behind somebody in Walmart that just ticks me off, and I'm done. I don't like this person now. I don't care who they are or what their life story is. I just don't like you right now, right? We all have that. We all have personalities, and we all have the potential for personality conflicts. You may remind them of somebody that they hated in high school. I don't know, right? But there could be a personality conflict there. Sure. We'll find somebody else for you to take care of. No problem. But it also could be that you aren't communicating well with your patient. If they don't understand what you're trying to do with them, their reaction will always be no. So sometimes we have to work a little bit harder with dementia patients to get our point across, to figure out how to communicate in a way that they can understand us. This is why you have to have a little more training to work with dementia. Good? Question? Did that help? Limited choice, though, is your friend, guys, with dementia patients. Limited choice. Give them power, but not too much. Okay, good. So let's go back to the opening. Hi, Ms. Jones. My name is Patty. I'm your CNA today, and I'm here to whatever. Is that okay? Now, I like to throw in somewhere in there, how are you feeling today? How are you doing? How's your day going? I want to know how my patient is overall before I start introducing a skill. Because if I get into this, hi, Ms. Jones. My name is Patty. I'm your CNA today, and I'd like to take you for a little walk. Is that okay? Now, if I didn't ask her how she's doing, she might say yes, because she knows I'm in a position of authority. She wants to make me happy. She's going to comply, whatever. But we get 3 feet down the hallway, and she falls down because she's dizzy, and she didn't bother telling me. Now, if I ask her, hi, Ms. Jones. My name is Patty. I'm your CNA today. How are you today? I'm not feeling so good. I'm a little dizzy. Do you think we're going for a walk? Absolutely not. Who am I telling? The nurse. So do you guys understand how that one statement can be a powerful tool for us? I like to throw that in there. How are you feeling? How are you doing? You're not required to do that for the test. You can skip right over that if you want to. But I want you to kind of think about putting it in, because it really will help your workflow as well. Plus, it makes your patient feel cared about. Nobody knows, nobody cares how much you know. Nobody cares how much you know until they know how much you care. Do you guys understand that?
Yeah.
So that one statement, how are you today, conveys that. Good? Questions? All right, once I've got permission, yay, then I'm going to close my curtain. Now, I know we're in a new setting. This is hard for me, guys. I don't do change well. I don't have a curtain to demonstrate this. We're trying to figure some stuff out, right? But I would close the curtain. Now, for the test, the curtain's not going to go all the way around the bed. It's very short because the evaluators need to see what you're doing. You're just, kind of showing that privacy is important. But let's think about those curtains for a second. Who touches privacy curtains? Who touches them? Nurses. Who else? CNAs. Doctors.
Family members.
Family members, sure. Patients themselves. So basically, everybody.
Yeah.
Everybody. Now, no shade on housekeeping. I love housekeeping. They help me out tremendously. No shade on housekeeping, but those curtains are only taken down and laundered once a year. They are sprayed with disinfectant in between patients, but they're only taken down and laundered once a year. Now, if you've ever been in healthcare, you know that people will touch that curtain with soiled gloves all day long. They don't even think about it. I'm going to teach you to think about it, but they don't. They'll go in, empty the catheter bag, and then open that curtain with that urine-covered glove. Is that curtain clean?
No.
I want that to be tied in your brain forevermore. You touch that curtain, it is not clean. What do you need to do to your hands now? Go wash them. If you touch that curtain, what's your next action? Wash your hands. You guys got that? Those two have to go together. If you go wash your hands and then touch that curtain, you are transferring pathogens to that patient like there's no tomorrow. Now, here's the problem. We're going to go back to page 21. Now, I'm going to tell you a little bit about your patients. Remember that you can't call up and make an appointment to go to a hospital, right? Can't make a reservation. You got to prove that you're sick enough to be there. That means that this place is full of the sickest people in our community. Full. Sickest people in our community. You ever stop to think about that? Right? These are pretty pathogen-rich environments. Now, me, working there, I'm pretty healthy. I eat right, I exercise, I got a decent immune system. I'm not sick. I got a decent immune system. Do you know who doesn't? Every other patient in that hospital. Because they are there sick, which means their immune system is currently fighting whatever brought them there. Their immune system is busy. Everybody starting to catch this? Their immune system is busy, and we put them in an environment full of pathogens. That should scare the crap out of every patient. This is the worst place in the world for a sick person to be. You want a sick person in a place without pathogens so that their body can fight off whatever it's currently dealing with. But no, we put them all together. Now, our patients aren't going room to room, cohabiting. There's not much pathogen transfer between you two because you're separated. But if I come over here and work with you, and then I come over here and work with you, and I'm not aware of infection control, I will bring your pathogens to you. Now, your immune system may not be able to fight those off because remember, it's already busy. That's a scary, scary thing. Now, here's some sobering statistics for you. How many of you guys like to ride roller coasters? Anybody? Anybody a roller coaster fan? All right. So let's say we have a roller coaster. It's got 25 seats on it. You guys all get in, and I tell you, okay, this is a fun ride. You're going to have a blast. But just to let you know, one person randomly here, I'm not sure which one, but one person randomly is going to fall out. Okay? Bye. Have fun. How many of you guys would continue to ride that roller coaster? You have a 1 in 25 chance of dying. Anybody? That is the odds in every hospital. 1 in 25 of the patients in that hospital will get something they did not come in with, and it's 100% our fault. 100% the fault of the healthcare workers. 1 in 25. And remember, these are not Walmart variety germs. These are germs that made that person sick enough to be here, and we're giving those to you. This is not something that you can fight off easily. So it's going to kill about 1 out of every 12 of those. You're starting to understand the gravity of infection control. This is not something that we're going to play with. This is what kills patients. It is serious. And unfortunately, a lot of people have been taught poorly on infection control. Now we're going to pick this back up on Wednesday, but I need you to understand the gravity of this. This is not just wear gloves for everything and you'll be fine. Doesn't matter if you touch the curtain with gloves, I don't care. No. This is, we only touch patients with clean hands, period. End of discussion. Good. If your hands have not just been cleaned at the sink just now, should you touch that patient? Good. Everybody okay with that? Okay. They're grading us on it. This is a critical checkpoint. If you touch that patient without washing your hands first, it is an automatic fail on the test.
Quick question. In the hospitals, there are hand sanitizers on the sink. Is it okay to use the hand sanitizer instead of the sink?
We're going to talk about the hand sanitizer on Wednesday on our next class. And yes, it's perfectly okay to use hand sanitizer. We're going to go by our facility policy, though, wherever we work, what their policy is. But I'm going to tell you the difference between hand sanitizers and hand washing and when each is appropriate. I've got this little guy. He's Jeremy. Here's my hand sanitizer. Isn't he cute? And sometimes he is appropriate, but there are other times that he's not. So we got to learn the difference. Okay. So, knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? I'm here to whatever. Is that okay? Close curtain, wash hands. Now that you have clean hands, you can go get your clean supplies. Supplies should only be touched with clean hands. Don't go get your supplies, bring them into the room, and then wash your hands. Would you want those supplies used on you? So we have to do this in a very specific order. Now, this is going to make sure that all of our checkpoints get checked off, right? So we're doing it for the test, but we really are doing it for our patients. Everybody good with that? Any questions? This is why a lot of these checkpoints are green. Green. What do you think red is? If green is go, red is stop. Stop. So red is going to be how we end every skill. Now, take a look at this, guys. Take a look at this. If you do your opening and you do your closing, you are going to get credit for about half of that skill. About half of that skill. Good? Good. So this is what we just looked at. Everything in green is going to be checked off by the opening. Everything in red is going to be checked off by the closing. And purple is skill rules. So we're following the care plan. Care plan. Remember, purple's always care plan. So when we get our testing skill set, this tells us the 3 skills that we're going to do. The evaluator is going to check us off of specific checkpoints that are already established. We're going to learn those as we go through this process. And as we're learning the skills, I'm going to teach you how to get every single one of these checked off using a principle that we've created along the way. And we're going to repeat those principles among multiple skills. That's why we're going to learn the principles and we're just going to reuse it. That's all you need to learn is what's back there. So this checks off all of those steps. Good? Okay, there's something that we call the Big 4. And these are principles that's on the back wall that are applied to every single skill. It doesn't matter what the skill is. Pick a skill, doesn't matter. And the opening is one of them. Right? I said the opening, every single skill. Closing, every single skill. Following the care plan, every single skill. And glove rules. These are what we call the Big 4. This is going to apply to every single skill we learn. Now, we've already learned skill rules. We're good there. We just went over the opening. You're going to hear it over and over and over again. We're going to learn the closing in a few minutes. Glove rules is something we're going to cover on Wednesday, first thing on Wednesday. But every single skill that we learn, all of them are going to have these 4 automatically. Now, we may have to add some more in, depending on the skill. But these 4 will be every single skill. Good? So what this does, everything all together, all of these puzzle pieces that you see here on page 27, all of these we use as a true puzzle. So we take this principle and plug them together, and it gives us a skill. So in reality, right, we're learning 20 skills, but in reality, we're just learning 12 principles. That's it. And we're going to rinse and repeat, rinse and repeat, rinse and repeat. Makes it way easier to learn. Okay, so we talked a lot about our scope of practice, and the scope of practice is designed to maintain resident rights. So those two things kind of go together, right? We have to remain in our scope of practice. That follows the care plan. CNAs do normal. We follow the principles. Remember, it's all about the patient. Report everything to the RN. It's our scope of practice. And we have to maintain resident rights as we do that. And one of the things about resident rights that we're going to learn is that we don't ever treat adults like children. Never treat an adult like a child. You know, something about this that just really kind of cracks me up. How many of you guys have ever had a bad day? Well, I'm talking about a really bad day. Like, you're ready to explode, right? So I want you to remember the really bad day that you had. And I want you to think about how you would react if somebody, especially a total stranger, came up and says, all right, now, you're just going to have to calm down. I don't know about you, but for me, game on.
Yeah.
Who are you to tell me to calm down? Never in the history of ever has anyone calmed down by being told to calm down. Usually it escalates. Now, in healthcare, we don't seem to understand this lesson because we get patients who are having a really bad day. You do realize that your patients are never having a good day, right? You guys do realize that, right? We're dealing with a population that is really, really in a bad place. Now, they might understandably be a little upset. And they might actually act out. And we, as healthcare workers, will go in and say, you need to calm down. And then we wonder why they come at us. I told you to calm down. And now we pull out restraints and we get doctor's orders for all kinds of medications. And that's the wrong way to handle this. That is the wrong way. And that all stems from the fact that we don't understand where our patient is at that moment. So let's talk about our patient for a minute. Okay? They are in a place full of pathogens and they are there pretty much against their will. And I'll prove that to you. If you get sick, where do you want to be? Home. Home. 100% home. I want to be on my couch watching my TV in my comfort zone. And I want everybody to bring me what I need and go away because I don't want to be bothered. Right? That's what I want. You know what your patients want? The same thing. But unfortunately, they're so sick they can't be home. They got to be here. And that's automatically going to make them a little grumpy because they want to be home. Now, on top of that, they're a little preoccupied with what's going on with them. They don't care about you. They do not care about you. What does this mean to me? I'm sick. Am I going to die? Almost every patient in the hospital thinks they're dying. They'll just ask them. They'll tell you, oh my gosh, am I going to die? Take a blood pressure on somebody, do a worried look, and watch what happens. Oh my God, what does it mean? Am I okay? Right? They freak out because they all think they're dying. They're preoccupied. Good? See that? Okay. So we have somebody who is not home, who is worried about themselves, preoccupied. Am I going to be able to work? How am I going to afford this bill? Right? All those things are going through their head. They're also probably preoccupied about things outside of the facility, like who's feeding my cat? Who's going to pay my electric bill? What is my significant other doing? Right? There are concerns outside of this place that are going to consume them that they have no control over. They feel out of control. What response do we get when somebody feels out of control? No. Oh, you're starting to put those pieces together? Our patients often tell us no because they feel out of control. Good? little psychology for you. Now, on top of all of that, right, that's a whole lot already. They're not at home. They're worried about themselves. They're worried about things outside of their control. Right? On top of all that, they don't understand what we're doing to them. We're speaking a strange language. We are all strangers to them. So let me give you a visual. Let's say you go to bed tonight. Cuddle up into your bed, you drift off into dreamland, and when you open your eyes, you are not at home. You are not in your bed. You are in a strange place that you have never seen before. And all the people around you are talking a foreign language. Foreign, Russian, Vietnamese. And then they start stabbing you with sharp objects. How are you going to react? Oh, absolutely. You're going to start fighting back. This is the experience of a lot of our patients. Now, you add into that the fact that we often medicate them. So they may not be in the right minds at the moment. And this is not a good situation for communication, guys. And we have to be aware of this and adapt our communication attempts to them. Be aware of where your patient is at. But we tend to focus on us. We tend to think, well, I told her I was going to do hand and nail care. But did she get it? Now, how many of you guys have ever been sleep deprived? I am right now. I woke up at 3:30 this morning, could not get back to bed because I was a bit stressed. Okay? I am sleep deprived. What do you think that does to your mood? You think you were grouchy before. Sleep deprived will put you over the edge, right? Grouchy, grumpy, sleep deprived. So we have a patient who is consumed with their own concerns. They are in a strange place. They don't always understand what you're saying. And healthcare, worst place to try to get sleep because you are interrupted about every 20 minutes. About every 20 minutes, somebody walks in that room. So we have to understand where your patients are. And we have to adapt our approach to them. So when I do the opening, hi, Ms. Jones. My name is Patty. I'm your CNA today, and I would like to whatever. That is not for me. That is 100% for them. And if you skip any part of that, it's going to affect your ability to communicate with your patients. Now, a lot of CNAs will do this. They walk in, very first encounter. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I need to whatever. And then they do it, and then they leave. And they come back an hour later, and they assume that patient knows who they are. Yeah, you guys are all in pajamas. They don't know the difference in what you're wearing. They don't know who is a nurse, who is a CNA, who is a housekeeper, who is a dietary aide. They don't know. They don't get a color code sheet to be able to decipher all of these colors. And truthfully, they don't care. So don't assume that they know who you are just because you introduced yourself an hour ago. Remember, they are sick, sleep deprived, consumed with their own concerns, right? They are paying attention to you. So every time you enter the room, you go through all of those steps, all of them, every time. So for the test, you're going to get 3 skills to do. For all 3 skills, you are going to do your opening. Hi, Ms. Jones. My name is Patty. I'm here to do foot care. Is that okay? Do foot care in the skill. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to take your pulse. Do the pulse in the skill. Hi, Ms. Jones. My name is Patty. I'm your CNA today, and I'm going to do range of motion. Do the whole skill. Do your closing. You are going to treat each one as if it's a separate patient encounter, not just for the test, but in real life as well. Good? Mm-hmm. Be where your patient is at. Don't expect your patient to be where you are. Good? Okay, so this is not a sales pitch. This is just a awareness. We have to learn all this. It's in your book, page 27. We're going to go over it step by step, all of that. But if you need an additional learning aid, I have flashcards. Flashcards have all of these principles. They have all the steps for all of the skills, and they have the supplies. So if you want flashcards, let me know. While you're enrolled in class, they're $14.99. I think I saw them online for like $29.99 now. But they're up there if you want to see what they look like on that little red stamp. Again, not a sales pitch, just a awareness. All right, so again, page 21, we just talked about this. Be aware of what is going on with your patient, where they're at, and adapt your communication to them. Now, the video I showed you a little while ago went into differences. Every patient is different. You can have 2 diabetic patients and they're completely different. You can have 2 hip replacement patients that are completely different. You can have 2 dementia patients that are completely different. Please remember that every person is going to be different. And we may have to adapt our communication to each person a little differently. Learn how to read whether somebody is accepting of what you're saying. Okay? To do that, we have to look at eye contact. We have to look at posture. We have to look at their nonverbal cues, but also their verbal ones. And you can ask them, do you understand what I need to do? And get them to reinforce it. But you really want to make sure you're adapting your communication to your patient's needs, not the other way around. So a question I get asked a lot during the test is, what if I make a mistake? So let's say that we're doing foot care and we get like 3/4 the way through and we look up and we realize we never pulled that privacy curtain. Oh no, we know it's a checkpoint. It's, you know, it's part of our opening and we just flaked out and didn't do it. What do we do now? Well, the good news is you can make a correction. Page 33 tells you all about that. You are allowed to make corrections on the state exam. It's as simple as saying, correction. I would have closed that privacy curtain before I started my skill, before I washed my hands. Now, remember deficiencies were something without a check mark? Well, now you get a check mark. Paper doesn't know whether you did it or corrected it. It counts the same. So you can make corrections, but you can only make corrections until you end the skill. So you're going to do the whole skill. Opening, knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? You're going to do the skill, whatever steps are required, and then you're going to do your closing. Thank you very much, Ms. Jones. Is there anything else I can get for you? Are you comfortable? Would you like a magazine before I go? Here's your call light. Open the curtain. Go wash my hands. Document if I need to. Wash my hands again if I document. And then my skill is done. Now, when you say to the evaluators, my skill is done, you can say my task is complete, I'm finished, whatever you want to say, I don't care. But when you end that skill, what you're really doing is ending your ability to make corrections to that skill. So my suggestion, you get done with your closing, wash your hands, go back and read that care plan one more time. Review the steps in your head. You've got some time to play with here. Review the steps in your head. And then make sure that you don't need to make any corrections. Once you're happy, then say, my skill is done. And then you'll go on to skill 2. But when you say that, my skill is done, my task is complete, however you're going to say it, it's your ending your ability to make corrections. It's all in your control. But they're not going to let you move on to skill 2 until you end skill 1. Okay, good. So you can make corrections at any time. It's best to make them right away, though, as soon as you figure it out. Don't wait until the end because you might forget. So if I'm like, you know, if I recognize that I made a mistake, I'm going to correct it right then. Okay. You are in control. So it's a good idea to reread that care plan one more time just to make sure. And you're just going to verbally correct. Now, sometimes the evaluator needs to see what you are trying to correct. So like, I can't say, yeah, I would have washed the foot and rinsed the foot and dried the, you got to do the task, right? So sometimes they will need to see, but if it's as simple as I would have closed the curtain before I washed my hands, that can be corrected verbally. Most of the time they'll need to see, and they'll tell you, we need to see that action, please. Okay. All right, so let's learn how we're going to go through all this. This is your syllabus. And yes, it looks very complex. Tatiana, yes, there is a cost to come to the class in person. It is, for my class, it's $350 to come study in my classroom. Okay, so this is our syllabus. Don't panic, it's okay. When you're looking at this, you'll see that going across, it's divided into days. So today is Monday. So this first section up here is everything today. So days go across. Now the columns, here you'll see in-class skills. And it tells you what we're going to be doing in class today. So we learned skill rules. We did that one. We learned the opening. We still have to learn the closing, hand washing, and indirect care. And I've only got 25 minutes. Don't panic. It's okay. Here we have lectures that I give. These are the pages that go with the lectures. So we've already talked about page 12, what to expect on the exam. We talked about delegation and liability. We talked about the patient. We've learned about testing care plans, and we learned about the principles. So we've covered all of that. Column 3 is your homework. We're going to talk about this in just a second. And then additional activities. We've learned about the 5 key phrases. We've learned about the care plan. We did that activity together. We learned about corrections, and we've learned about skill grading. We still have to do warm, dark, moist. We'll get to that in just a minute. But this column, if I don't get to that lecture in class, you need to read this on your own. Okay, so this column, if I don't get to that lecture, you need to read it. It's additional homework. Let's talk about homework. Yes, dreaded homework. I know, nobody likes it. This is the book we use for homework. So the way this works is that on Mondays, you will have 1 chapter of homework between Monday and Wednesday. From Wednesday to Monday, you have 2 chapters. So tonight, you'll go home and read chapter 1 in the yellow book. And then you're going to take a test in the spiral book on page 181. The test in the spiral book is on page 181. And it just makes sure that you learned what you needed to learn from chapter 1. That's it. But it's not just enough to take the test. You probably need to grade it. Make sure that you learned what you needed to learn. That way, if you get something wrong, you could go back and review it. I don't care about grades. I don't care. Probably the only teacher in the history of ever that does not care about grades. I'm going to ask you on Wednesday, how did you do on chapter 1? I'm going to go through all of your names, and I'm going to ask you, how many did you miss? How many did you miss? If you told me I got 100, I'm going to assume you did the reading and you answered the questions and you have no questions. If you tell me I got a 70, I'm going to go, whoa, okay, let's talk about this. Let's figure out why. What is it that you struggled with? What do I need to explain? Okay, so your homework is your opportunity to identify your own learning gaps and let me know when you need help. Good? This is adult education. Your responsibility to identify your own learning gaps. I am here to help you remediate them, but you need to identify them using these tools. Does that make sense? So I don't care about grades. If you're happy and you're comfortable and you did the reading and you answered the questions and you have no questions, that's great. It's great. But if you need help, you need to let me know. Okay? Good? So let's talk about how to use the study guide. We're going to get through this really, really, really quickly because I'm running out of time. All right. So we're going to talk about the spiral book right now. So if you go to page 52 in your book, this is a skill we're going to learn how to do. Pulse. Not today, but we will learn eventually. But I want to show you how this book works. So you'll see a big banner here. This is pulse specific rules. These are steps we're going to learn when we learn how to take a pulse. But those aren't the only steps involved. We still have to read the care plan. We still have to do our opening. We still have to decide if we need gloves, and we still have to do the closing. So yes, these steps are important in taking a pulse, but that's not the whole story. That's just one part of the whole skill. Every skill we do is going to have a page like this. It'll show you what principles are going to be involved in that skill. Again, I have a video. Down the side, you'll see the principles, the short version of the principles that are involved. You'll see them all spelled out here. This is the short version of the skill, the Cliff Notes. These are the skill-specific steps, and I have a video. Now down here, this is test-specific information, and we'll go through this again as we go through each of these skills. We're going to cover this again. This is an intro, so it's going to be really quick. So down here, you'll see a little clock tells you how long somebody with your level of experience should be able to do this skill in. So this skill, you, as a brand new newbie, should be able to take somebody's pulse in 5 minutes or less. Care plan tells us to count for 1 minute. Now, yes, we have to do the opening and the closing, but even still, the opening. Hi, Ms. Jones. My name is Patty. I'm your CNA today. How are you? I'm here to get your pulse. Is that okay? I'm going to close my hands, close your curtain, wash my hands, and I'll be right back. Count the pulse for 1 full minute. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine? Here's your call light. Wash my hands. Document. Wash my hands again. You do all of that. You have 5 minutes to get all of that done. Way more time than you need. Way more time than you need. Do not rush. You have way more time than you need. But there is a time limit to it. Now, the second thing that you're going to see down here is who your patient's going to be. It could be a testing student. We talked about that earlier. But it also could be done on a mannequin. We do have 4 mannequin skills that we're going to learn. 4 mannequin skills. It'll tell you where that person's going to be, in a bed or a chair. This way, when you're home practicing on people, whoever those people are, you put them in the right place, like the test. Dress rehearsal. So it tells you, you can put them in a chair or you can put them in a bed. And finally, it'll tell you whether charting is required. Remember, there's 4 documentation skills, 4 charting skills. Pulse, respirations, feeding, and drainage bag. So the next page, which in this case is 53, is going to tell you how to do that skill. So page 52 was the overview. The Cliff Notes. Page 53 is specifics. So we have, we have practice questions on every single page, or every single lesson. You have practice questions. You also have, go back here, the care plan at the top of the page. You have step-by-step instructions that tell you exactly how to do these skills. Supplies are at the bottom. These steps are going to correspond to the checklist. Remember I said you needed an RN brain to filter those checklists and spit it out in a way that you could understand? That's what this is. Now, I know that we're running short on time. It's okay, but I may keep you like 2 or 3 minutes over. Bear with me. I'm sorry. There's a lot to tell you. How many of you guys have ever made a peanut butter and jelly sandwich? How many steps do you think are involved in a peanut butter and jelly?
3.
3?
There's a lot of steps.
So now that you're thinking about it, there's a lot of steps, isn't there? There's actually 42. 42 steps. No, we're not doing anything crazy like baking the bread or toasting it or anything like that. Let me go through it really quick. Okay. Less than a minute. Here we go. You have to get the bread out of the wrapper, which means you have to undo the twist tie, open the bread, get 2 slices of bread, spin it, put the twist tie back on, put it back on the counter. You have to have a place to put that bread. So you've got to open the cabinet, get a plate, close the cabinet, put the plate on the counter, put the bread on the plate. Go to your pantry, open it, get your peanut butter, close it, put the peanut butter on the counter. Go to the fridge, open the fridge, get the jelly, close the fridge, put the jelly on the counter. Unscrew the peanut butter cap, put it on the counter. Unscrew the jelly cap, put it on the counter. Open the drawer, get a knife, close the drawer. Knife, peanut butter, spread it. Wipe it off on the other side of the bread. Knife, jelly, spread it. Put the knife in the sink. Put your sandwich together. Put it on the plate. Put the lid back on the peanut butter. Open the cabinet. Put it in. Close the cabinet. Put the lid back on the jelly. Open the fridge. Put it in. Close. Now you can eat 42 steps. How many of you guys realize that peanut butter and jelly was so complex? Okay, if I can make peanut butter and jelly sandwiches 42 steps, imagine what I can do with a partial bed bath. I want you to keep in mind that the number of steps does not matter. Peanut butter and jelly has 42. Every skill you're going to learn is less than 42. Theoretically, every skill is easier than a peanut butter and jelly sandwich. Do not get wrapped up in the number of steps. I'm going to teach it to you in a way that makes it a no-brainer. Good? Questions? A lot of steps. Every step is going to correspond to a checkpoint in some way. I have a whole course that you guys are all going to get access to later today that will help you put into practice what you're learning. This is an interactive course. Yes, it has video lessons, it has slide-based lessons, but the real meat of this is the interactive activities. So let me show you what I mean. Remember the opening. We're going to do it for every single skill, right? We've learned this. This is the how to do the opening, page 31. Breaks it down for you, but we've already gone over it. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands, get supplies. We know this now, right? Right? Let's see if we know this. Every lesson in the online course is going to be laid out something like this. You're going to have a video that tells you a little bit about that skill. Below the video is going to be an activity. This is what we call a drag and drop activity. And yes, you can do this on your phone too. Drag and drop activity. So we're going to do this together right now. So if you look at all these steps, there's 8 steps there. What is the first step that we need to do? What is, based on those 8 steps, what would the first step be?
Care plan.
Good job. Absolutely. We have to know what to do. So we are going to read that care plan. Now, what do you want to do? Now we can knock. Good. What's our next step? Identify the patient. Yeah, they need to know that we know who they are. Yeah. What's next? Okay. Your name? I always think of that song. Say my name, say my name. I can't sing. All right. What's next?
Explain the task.
Explain the task. Okay. What's next? Okay. And then?
Wash your hands.
Wash your hands, and then supplies is last. So you have this activity in the online course, and you can do this. If you get it wrong, there will be red boxes around all the wrong ones, and you're going to have a retry. When you hit retry, it scrambles them all. You got to start from the beginning. This is what's called forced comprehension, because when you do it over and over again, you will then learn those steps. You will know what's first, what's next. You do this 2 or 3 times before, for every skill has this. Every single skill we learn has this. You do this 2 or 3 times before you practice, you will then know the steps you need to take. Good? This is very helpful. All right, good start. Good job, gold star. Closing, we went through this briefly, but specifics are on page 35. You're going to want to read this tonight because I have to go through this kind of quickly. But the closing, there's 8 C's of the closing. This. You want to make sure they're in a clean and safe environment, right? So the bed is in the low position. I always leave my patient looking better than I found them. That's just a great rule to live by. Leave your patients looking better than you found them. Housekeeping does a great job, but they're there for the big stuff. They're not there to keep the environment clean, and people don't rest well in a chaotic environment. The environment really needs to be neat and orderly, and that's a CNA job. So clean and safe. Then we want to make sure they're comfortable. The test has to hear that word, are you comfortable? They need to hear it, comfortable. But comfort is not just physical, it's also emotional. Imagine how boring it would be to be stuck in a place with no entertainment. You guys are going to experience that in the test, in the waiting room. Remember, you can't take your phones in. So you think that's awkward? Imagine being a patient. You don't have your family there, not full time. TV selection, very limited. They may have a cell phone, maybe not, but it's still going to get really boring, right? So emotional comfort is also a part of this. So we're going to ask them, do you want a magazine? Now, in a clinical setting, I'm not passing magazines around, but we're going to do that for the test, offer one for the test so they know we know emotional is important. Good? Make sense? Makes sense. One other thing for the test, I forgot to tell you this. When they call you in to test, so like you guys were group 1, when they call you in to test, the rest of you guys can all go out to your car and study. Okay? Until they'll tell you, you've got about a half hour before you have to be in. You've got about 45 minutes where you have to be, hour and a half. So you can go out to your car and study. You have study material and your phone. Don't take your phone into the testing center, though, because they'll confiscate it. Leave it out in your car. Good? Good. All right. Patients have to be covered. I call this the no knobby knees theory. I don't want to see a patient's knees. They're in a bed in a hospital gown. I don't need to see their knees. Make sure they're covered. If they're dressed, that's fine. I don't see their knees. But if they're in a hospital gown and they're in bed, they need to be covered. We're going to open that curtain, give them the call light. Doesn't matter which ones you do first. That call light is just as dirty as that curtain, people. Patient scratch what itches. And then use call light to tell you about it. Okay? Call light's still dirty. So once we're done with all that, what do we want to do? Clean your hands. I call this cooties, right? When we work with patients, we're getting all cootied up by that patient. Before we move on to the next patient, let's get rid of those cooties. So once we have washed our hands, do not return back to that patient. If you go wash your hands and then you walk back over and hand them the call light, what did you do? Yeah, you re-cootied up. Absolutely. We've got to address that. So if you realize you're over at the sink, you're washing your hands, realize they don't have their call light, and you go back to give it to them, what do you got to do again? Wash your hands. Absolutely. Starting to get that infection control thing? All right. After you clean your hands, then you can chart if necessary or document. Do not touch a pen with dirty hands. This goes into your pocket, goes in and out of every room. Worse, goes home with you at the end of the day. Do you really want those hospital germs in your home? You should only touch a pen with clean hands. And then our final checkpoint on every single skill is end skill with clean hands. So if we charted, we have to wash our hands again. End skill with clean hands. So documentation skills require 3 hand washings. 1 at the beginning, 1 when we're done working with a patient, and 1 after documentation. Good? Questions? All right, the activity for this is a little different. For the closing, it's actually a hot spot. So you have to touch everything you have to do in that room before you end your skill.
Do we chart before or after we wash our hands?
You're going to wash your hands, chart, wash your hands again. Okay. Yeah. And you can see the closing, all of those steps are on, hold on. All of those steps are on page 34 and 35. Good? Good. All right, so how do we wash our hands? Like I said, I'm going to keep you probably 2 or 3 minutes over. These are the steps involved in washing hands. step-by-step instructions here, but I'm going to show you the video for this. It takes about 2 minutes. So bear with me. I know I'm running a little bit late. I'm sorry. You're not going to be told to wash your hands. Nobody's going to tell you go wash your hands. You have to know when you're supposed to wash your hands. They're grading on knowing. We'll talk about this later.
When you approach the sink, you can touch the faucet with your unclean hands because the faucet is considered the dirtiest object in the bathroom. Adjust the water temperature for comfort and wet your hands. Apply soap and rub all surfaces of your hands vigorously, focusing on the front and back of your hands and in between all fingers. Circle the top of your wrists as well. Friction is the key to removing all pathogens from the surface of your skin. Friction should be applied for at least 20 seconds to be effective. After washing with friction, the nails must be cleaned. Run one thumb down the length of each nail, starting at the cuticle and moving toward the end of the nail. Repeat with all fingers of both hands. Then clean under your nails by scrubbing the underside of your nails along your palm to remove debris. Carefully rinse your hands under the stream of water with your fingertips pointing downwards, taking care not to touch the inside of the sink or the faucet. Tap your fingers together to ensure that all water droplets remain in the sink. Take paper towels from the paper towel dispenser and dry all surfaces of your hands, the front, back, between your fingers, and your wrists, taking care not to allow the paper towels to touch the unwashed areas of your lower arms. Throw these paper towels directly into the trash bin. Finally, take a clean, dry paper towel to turn the faucet off, because wet paper towels may rip and recontaminate your hands.
Okay, so we're going to talk about hand washing a little bit, as we go through. This is not the last time you'll see this. We're going to, work on that later. But I need you to understand a couple of things. Number one, bubbles count. They look at how much lather is on your hands. Don't get soap until your hands are wet, because your hands, if they're dry, the soap is not going to distribute well. It clumps. Good? Those are the important parts here. I want to talk to you about warm, dark, moist. We need to be aware of this as CNAs. Warm, dark, moist is the ideal breeding environment for pathogens, all the bad guys. Bacteria, viruses, yeast. Bathrooms are always warm, dark, moist. We turn the light off when we leave. It's usually 2 or 3 degrees warmer because we don't like to be chilled when we get out of the shower. And pathogens are already there. We drop them off every day. So pathogens live in the bathroom. When you shake your hands like this and you create water droplets all around, those are pools that those pathogens can then use, because pathogens need fluid, can then use to proliferate. And then you walk through that and you go around the facility, and even worse, you go home with pathogens on your feet. So that's why we tap. We tap to keep the moisture confined in the sink, not spread in our environment. The best place to practice your opening and closing is in your bathroom at home. You've got a door you can knock on. You've got a person to talk to, the one in the mirror. You've got a curtain that you can pull, which is your shower curtain, and you've got a sink right there to wash your hands. So tonight, you all should be practicing your opening and your closing. Have your book in front of you and just read it. Because, I wrote it out for you. Just read it until it becomes second nature. Practice hand washing as well. All right, so, let's go. Hold on, I better find it here. So I do have a lesson on this. This same video is in that online course. You guys will all get access to that a little bit later today. And these are the steps. So real quick, can somebody tell me what our first step is?
Turn the water on.
Turn the water on. What's our second step?
Wet hands.
Wet hands.
Rinse all surfaces.
Apply soap. Okay. Now what?
Lather all surfaces.
Lather. Okay. For how long?
20 seconds.
20 seconds minimum. And then we're going to, what do we have?
Rinse all surfaces.
Rinse. You got to rinse that soap off. And then we're going to
Dry.
dry. You'll turn that water off with a clean, dry paper towel. Good job. Gold star. We're going to talk about simulations because I'm out of time. We're going to talk about simulations at the beginning of Wednesday's class. So, indirect care, really quickly, I have a whole lesson on this in the book. You can read this if you want, but it really boils down to treat the patient how you would want to be treated if you were the one in the bed. That's indirect care. How would you want to be treated if you were the one in the bed? It is graded. Indirect care is graded. They are graded checkpoints. It's not enough to know how to do the skills. You've got to be able to do them with empathy and compassion as well. Okay? But these are things they're looking at. Eye contact. Remember, half of our job is observation and reporting. If we can't make eye contact, you aren't observing. Tone of voice is important. Rate of speech is important. Facial expression, body language, explanations, posture, and your overall attitude. Those are all important when you're working with patients, but they will impact your score on the exam as well. Okay? Remember your homework. You're going to read chapter 1 in the yellow book. You're going to take the test on page 181 in the white book, and you're going to grade it. When you come back to class on Wednesday, I'll go through my list and ask you what your scores were. Real quick before you go, on the front of your yellow book is a letter and number, probably Y something. When I call your name, please tell me what your number is. Paula.
Y18.
Y18?
Yeah.
Thank you. Olivia.
Y5.
Thank you. Cindy. Cindy? Y3?
No, I'm sorry.
1-3. Okay. Y13. Got it. Gabriella?
Y1.
Y1? Oh, I have two. I have Gabriella and Gabrielle. Oh, that's going to be confusing. Melissa?
Y11.
Ariana?
Y17.
Fabrice?
Mine is blank.
Blank?
Yes.
Okay. That's fine. Brianna?
Y9.
Antonio?
Y12.
Gabrielle? Hinton?
Y1.
Daniel?
Y16.
Drew?
Y6.
Brianna?
Y4.
Amara?
Y2.
And then Mahala?
10.
Okay. Got it. All right, guys. Thank you very much. If anybody is lost, if I went too fast for anybody, please stay after class and let me know. Bring your spiral books and your red bags and contents back to class with you on Wednesday. Don't forget your homework. Best of luck to you, and I really am happy to meet all of you.
Thank you.
Oh, thank you.
Thank you so much.
Thank you. You too. Thank you. You too. Bye-bye. 8. Okay, sorry. Got it. You're welcome.
Thank you.
Thank you.
Oh, sorry, my bad. You're good.
Thank you so much.
Thank you.
Thank you, man.
Thank you. Have a great day.
What was that term called again? Blank of scope? What was that?
Scope of practice.
Okay, thank you.
Scope of practice.
Thank you.
You're welcome. All right, those of you joining us virtually, we're going to go ahead and sign off. Remember that we have the game show tomorrow at 11 a.m. on our YouTube channel for your CNA. And we'll be back in class on Wednesday at 9 a.m. Hope to see you here. Until next time, happy caregiving. Bye.